where the patient is wearing the VR headset, and then the doctor is actually doing some kind of dressing on the hands. So to make the patient to tolerate the pain, where he is already engaged with some kind of VR environment. So it may be helpful for the persons to tolerate the pain. Then rehabilitation. Rehabilitation is the another major department on the health sector um, where for the rehabilitated people, like they have to do lots of exercises, they have to go for the physiotherapies, but many of them are getting bored, and then they will not tolerate their pain, they will obey for the physiotherapists. So where if we use the virtual reality in applications to make them to get play the games, kind of gamify the application, where the patient will feel something good, and then we can make the patients to do some kind of physiotherapy exercises, or some kind of exercises to help them to come out of the paralysis, or paralysis attack, something like that. I will show you a next slide where you can see there's a person where she's holding a controller, as I already shown you, some kind of like this, some kind of controller like this, where you can see the application where she's trying to lift her hand. So where she's visualizing something inside it, where she have to make the hand should be rotated to be where, since the app itself gamified, so uh, the patient will get engaged, and then where they will obey the physiotherapist uh, uh, instructions, and as well as it will be helpful for the doctors as well to make the people to turn themselves into the normal persons. So many VR applications are actually building. Many companies are actually building the VR applications for the rehabilitation. Even we are also working on some kind of VR rehabilitation application. For the past 1.5 month, we are planning to build it, and then planning to launch it in a couple of months. So we are also working on the rehabilitation kind of VR application. So then the mental health therapy. So if we take the patient, the mind stress should be reduced. If we are getting sick, basically we will get our brain will get uh, sick, like something like many of our works will get spoiled based on because of the some kind of sudden something happens for our health. So where if we make our mental health should be good, where it will be helpful for the patients to make them to get cure from the diseases. So where the VR is also helping for the mental health therapy. Basically, without VR, in some places, the people use the music therapy, where they can put very pleasant musics to make the brain to come out of the stress level. But comparatively, it's only the audio based, where if you go for the VR, where it is based on the visual, and as well as like video and audio kind of thing. So even the VR is also helping for the mental health therapy, and as well as I told you, where it the all kind of VR application where we will be able to uh, can be built, that can be controlled by the doctors or any kind of uh, nurses, something like that. So as I mentioned over here, these are all just four subsectors of the health sector, how we can use VR for the different purposes. Apart from this, we have so many scenarios available where we can make the VR application or the VR technology that can be helpful for the healthcare. So I would like to play a video. It's completely a VR application simulation recorded with the VR headset. Just see, you will get understand how it is going to helpful for the MRI imaging trainings. Yeah. So if you see in that in this video, like we'll see in the hand environment. So we have some available. So we have where they are holding uh, interacting with each and every UI, the index finger, and with the hand interaction. This is a very simple use VR for the to provide training for the people who is going to take the scans. So now, so far we have discussed about what is VR technology and how it is going to helpful for the healthcare sectors, and then I have just listed a very few kind of subsectors of the healthcare, and then how it is going to help on those sectors, and then I have given some kind of scenarios over there. Now we are just going to start discuss about the augmented reality. I just wanted to ask you, like, how many of you experienced the augmented reality before somewhere? Um if anyone experienced the augmented reality, can you raise your hands? I'm not seeing any hand raises. Am I audible?
Yeah, it's audible, sir. Audible, sir.
Okay. Dear participants, I just wanted to know how many of you experienced the augmented reality before? I'm seeing one hand raise. Then others like no one experienced before. Uh, Have you aware of the Google animals? Have anyone tried the Google animals?
So they are answering in the chat box, sir.
Oh, okay. Let me see over there then.
Yeah, yeah.
Okay, no. Okay.
Most of them
Whenever,
telling no only, sir.
no, no, only. Okay, maybe whenever you guys get time, I'm not sure. I think most of you attending the session from the mobile only. I think so. Uh, if possible, you can experience the AR now itself. Like, just go to the Google, search for tiger. Just search tiger, where if you scroll you can see the 3D tiger. Just open it where you will get the button called as view in your space. If you click on it you can see the tiger in your living area. That's the very basic experience that you will get. Or right now we have the AR has been added in all the Flipkart and then Amazon also. You may come across maybe while ordering the product you can see test it in your environment. If you
Excuse me,
click
sir.
that button, yes.
Sir, just if you show the demo means it will be very useful for our participant, I think so.
Yeah,
Because
I added so many slides. Hereafter it is coming, sir. Actually, they can scan and then they can experience.
okay, sir. Whatever you have discussed previously, in order to see the 3D views, just to share that video. That also would be very useful for our participants, sir. Because no,
Uh,
huge number of participants they didn't know about that experience. So if you show that link, means they will just open in the mobile itself. They will get the idea about that, sir.
then I'll do one thing. I will join from my mobile phone immediately, and then I will show that share my mobile screen, and then I can show how the Google Animal works, and then they can also try later. Maybe I added so many AR content in the slides as well. So meanwhile, they can also experience during the session itself.
Yes,
Okay,
sir. Yes, sir.
just
Already I attend your session, sir.
yeah. I remember, sir. I'm just connecting with my mobile. Just give me a minute.
Uh, Tell the name, sir. I will give you co-host to you, sir. Sir, you can stop sharing the laptop, sir.
Yeah, definitely, sir. Sir, can you give permission to share my mobile screen? I joined in the name of Ashok Mobile.
1 minute, sir. I will give you permission. Ashok, sir, tell me your name.
Ashok Mobile.
It's not showing. Yeah, I got it, sir. I gave permission, sir.
Right, share.
Sir, echo is coming from your side, sir.
Hope my screen is visible.
Yeah, visible, sir. Visible, sir.
So I'm just searching tiger in the Google. Just tiger. It is not showing. Let me stop share my screen and then check again, because maybe sometimes this feature will not work on the screen sharing. Let me check and then come back. I'm just stopping the screen.
No issues, no issues. Excuse me, sir.
Yeah, yeah, sorry, yes.
At the end of the session, we will solve these demos, sir. You can continue the session, sir, because after your session, they are having two more sessions, sir, today.
Okay, okay, okay,
So
okay.
we want to finish the session in time limit, sir.
Yeah, definitely, sir. We will. No issues. Okay, actually, I will share my screen. I'm not able to see that Google Advanced. I'm not sure what happened, but I found it on the Amazon. Let me share. You can also experience this from your Amazon or Flipkart application as well. You can say just search it for the fridge, and then if you see, you can see view in your room. I just click on this camera. So where I have to point it somewhere else. You can see the fridge has been added. Are you able to see?
Yes, sir. Yes, sir. Yes, sir. It's visible.
Yeah. So I'm able to drag this, rotate this. So this kind of tech we call it as a augmented reality, which means that augmented reality is a technology where it's not the completely immersive environment. As I told, augmented reality, sorry, virtual reality is the completely immersive environment, but augmented reality is not the completely immersive environment. Just give me a minute. Yeah, okay. So, where augmented reality is not a completely immersive environment, where instead of that, we will be able to see the virtual object in the real world. As I already shown you, like we added the virtual fridge in my living area. My living area doesn't have any kind of fridge, but as I have added it with the help of the augmented reality technology, where a user will be able to interact with both real world and as well as the virtual world, virtual objects. So this kind of tech we call it as a augmented reality technology. It's a partial immersion, not the complete immersion. We do not require any special hardware to experience the augmented reality as similar to the VR. I have shown you something like I have shown you the VR headset like this, right? But for to experience the augmented reality, we don't need to go for any special hardware. Our normal smartphone alone enough to experience the augmented reality. So here also I have added a small augmented reality demo. Like if you have a mobile phone with you, you can scan this QR where it will open a application, and then if you scan back, you can see the some kind of augmented reality content over there. So let me showcase one here with the help of this QR. Later you can also test it down. Just give me a minute.
Sir.
Sir, can you give the access again for the Ashok mobile?
Yeah, I will provide, sir. Provide. Yeah, it's provided, sir.
Yes. If anyone attend from the system, you can also check it out. I'm just going to scan this QR. And then you can see there is a robotic arm. It is getting added and it is animated. Are you able to see?
Yes, sir. Yes, sir. Yes, sir. It's nice to see, sir.
Yeah. So this is the simple example of the augmented reality. I have shown two types of augmented reality here. Uh, Let me share my screen again. Yes. So we have different types of augmented reality. So we have the marker based, markerless, and then projection based, and as well as the superimposition based. These are all the major four types of augmented reality applications that we will be able to build. In that case, a marker and then markerless are the many industry who is working on right now. Marker based augmented reality, where the virtual object will get superimposed on any kind of images or some kind of augmented reality marker. The example is just in the the previous slide, I have scanned the QR, and then you have been seeing some kind of marker with the black square with the alphabet A. So that is the augmented reality marker. So you have seen some kind of 3D arm, right? So that 3D arm can only be superimposed if I scan that particular marker. Hence, I am not supposed to superimpose any kind of the 3D content on my living area. But in case of markerless, that fridge you have seen now, that is the example for the markerless augmented reality, where instead of superimposing the object on any kind of image or marker, you can simply superimpose the object. You can visualize it on your living area directly by simply scanning the floor. So marker based and then markerless kind of augmented reality application where many industries are actually working on so far. So here is the example of the marker-based augmented reality where you are seeing that the people are seeing the skeleton on the QR code. So this can be only visible on that particular QR code, not on the other QR codes. They have built the application something like that. And then for the markerless, I already told you, we should not require any kind of augmented reality markers or QR code or images. We can simply place it wherever we want. This is the example. This is how the Amazon and then Flipkart has been added this feature on their applications. So here the user is the TIPA is actually visualizing by the user near to their sofa. Whereas projection and superimposition based on the little advanced kind of tech, advanced kind of augmented reality application. So where the projection based, it's where right now I'm not sure how many of you come across the smart glasses, where we have the smart glasses where we'll be able to see everything on our glasses itself. Before now we have the Google glasses. I'm not sure how many of you are aware of it. Right now the Google glasses has been stopped by the Google, but it has been available some 6 to 7 years back. You can see this is the smart glass where we can visualize everything through our glasses itself. I have added the example over here. Many of the smart glasses right now in the industry is working based on this kind of methodology only. Even we have the geo glass as well. Even if you get time after the session, just go and search about the geo glasses. You will get understand about what is the use of the geo glass. Okay, now the superimposition based, where the imposition based augmented reality is the more advanced kind of augmented reality application, where the application take the real world data and real world data along with the measurements, everything, where it will project the some kind of remaining portions or some kind of virtual content that will make the object will get fulfilled. Example, we have the motorbikes. Imagine our motorbike doesn't have the side mirror. If you want to have the side mirror, before placing the side mirror, you have to visualize how your bike will get appear if you add the side mirror. Over there you can use the superimposition based augmented reality kind of application where it will completely take your bike data, which means each and every bike has the different measurements, right? So where it detects where to place the side mirrors, where it will add only the virtual content where you can see how your bike will look like if you add the side mirrors physically. So here I have added some kind of example. You can see this kind of unconstructed building. So if it get completed, how it will look like? They are visualizing with the help of the AR application. So where this kind of application, we call it as a superimposition based augmented reality application, where it will completely take the real world data and then real world visualization. IIT is actually doing a research on building the superimposition based augmented reality, where we have been interacted with the team some 2 years back, where they are building kind of application. It's an empty land. If a building has been constructed on the empty land, how the building will look like. So they are working on some kind of applications like that. So I just wanted to share this with you so that you will get understand this kind of application researchers, application development research is going across the industry. Now, how the augmented reality help for the healthcare? So, as I told, like the augmented reality can be helpful for design and prototyping, like any kind of machines, any kind of healthcare machineries, any kind of healthcare instruments where they are designing. And then before manufacture it, if they wanted to test how it will look like, where they can convert it into the 3D model and then they can visualize how it will look like. Even again, I will share my mobile screen and then I'm just going to showcase. Suppose if a company who is manufacturing the microscope, they wanted to visualize how the microscope will look like once it gets manufactured. Uh, so I'm sharing my screen. Hope it is visible.
Yeah, it's visible, sir. Microscope is visible.
Yeah, right. Just give me a minute. I will share my screen. Yeah. So as I told you, for the design and prototyping purposes, we can use the augmented reality tech. Uh, to see how the product will look like once the manufacture has been done. So where we can it will helpful for the non-defected component manufacturing, and where we can use it for the simulation and testing. So if the machine is something like how it will look like, where we will be able to test it with the augmented reality. I have added the QR code over here too. So if you want, you can also test over here. Maybe after this session also, I am ready to share this PPT with you. So whenever you get time, you can scan this QR codes and then you can experience the augmented reality in your places also. So collaboration in the sense, which means imagine like the doctor is doing surgery in the surgical room and then they wanted to interact with some kind of senior doctor with the augmented reality support. You can see over here I have added the image over here where they can do the live video chat. It's video chat means not kind of meet what we are having now. It's a kind of, it is going to happen in the augmented reality environment. So this is where we have been seen so many things, something like this in the Hollywood films. All those things are the augmented reality applications only. And we can also use it for the training, like how we can if the machine is available in the place where suppose if there is a surgical instrument is available. Imagine a doctor is using the augmented reality application. We have three to four kind of surgical instruments. They wanted to know which particular instrument have to pick right now. So where if we use our application where it will get scan over there, it will suggest, the application itself suggests take this, take that, something like that. And then passionate education. So where this passionate education, uh, like if you want to right now we are taking the x-rays and all, right, like MRI images or the CT scans or the normal x-rays. So all those things are the in the image format, but the patient want to see how actually is available inside our body, where we can with the help of the x-ray data or the MRI imaging data or the CT scan data, where we can create the virtual objects based on the patient data. We can showcase it in the real world. So that is possible. I have added the heart over here, so where you can visualize the human heart over here. Maybe if the time permits, I will showcase it later, since we have to cover the AI. So this is how the augmented reality application will helpful for the healthcare. So uh, again, whatever I have mentioned over here is only the limited one. We can use the different sectors in the, yeah, by AI. And then I have shown some kind of scenarios so far that can be possible for VR and as well as the AR. And since many of you, I think 90 percentage of the participants may attended so many AI based webinars. So you are much aware of what AI is. I hope I am right. Yes. If yes, show me thumbs up. If I show me thumbs up, yes, I'm getting the reply on the chat boxes. So now it's our time to discuss. After seeing so many scenarios that I listed, what do you think? Where can we use AI in the environment in or the scenarios that I have shown so far? I just wanted the input from the participant side from right now. Since you have seen so many scenarios on VR and AR, can you tell how we can add the AI with those kind of scenarios, and then how it is going to add the extra crown to the healthcare sector? Euroja said participants can able to unmute and talk, right? Or you have to.
Yeah, now
Sir,
only I
we have
given
to give the
permission.
permission, sir. We will give the permission to unmute
Okay,
themselves,
okay.
sir.
So they are giving the permission to unmute yourself. So can you?
Dear participants, we have given the permission to unmute yourself. If you have any questions, you can ask those questions.
Not questions actually. I just wanted to get the inputs from the participants since
Okay,
they
sir.
have been, yeah, they have been listening, and then they are learning about, they have visualized some kind of thing on AR and VR, and with many scenario images I have shown. Wanted to know what kind of AI feature and then how AI can be integrated with AR and VR, especially on the healthcare scenario that I have shown so far. Can anyone give some kind of input?
Yeah, good evening, sir. Good afternoon, sir.
Hi. Good afternoon, ma'am.
So myself, Mutulakshmi, as a AR VR will be used in the computer vision, and we will detect the diagnosis, and then we will see the how what are the treatments the patient will need. For example, we can use in the concept of eigenvalues and eigenvectors. We can detect the patient monitoring details.
Mhm. So which means you are telling like, as we all know, AI will help us to take the decisions.
Yeah,
Where we train the model. Yeah. So, Muthalakshmi ma'am, thank you so much for the input that you have given.
Yeah, thank you, sir.
Yeah, so that where we can add any kind of AI feature with any kind of AR and VR application scenarios, um, it will help us to get the data. It will help the applications to take some kind of decisions. Example, I just wanted to go back here. Let's talk about one scenario in VR, one scenario in AR, so that you will get understand. You can see where it's a simple rehabilitation VR application where the patient is lift her hand towards up and down. Right now, the application doesn't have the AI feature, but if AI has been added with this VR application, it may suggest during the live experience itself, your hand is you are moving your hand wrong, you are not up to the mark, or try something little bit. We can make the patient to encourage with the AI model. So where we can add the AI over here to make it's a dynamic. See, if we added AI over here, whatever the decision, whatever the suggestion the AI model is going to give for the patient is not common for all kind of patients, because not all the patients are going to lift their hands or one like 70-degree, 90-degree, or 120-degree, something like that, right? So some can lift their hands up to 40-degree, some can lift their hands up to 20-degree based on their own health. So where if we have the model, if we give the patient's data priorly to the VR application, suppose let's take Ashok, let's take Kumar, something like that. We have the two patients where Ashok, based on the Ashok's health condition, where he will be able to lift his hand up to 20 percentage only. Where the AI model detects by giving the name patient name Ashok, something like that. Where if I lift my hand up to 20-degree alone, where it can encourage me, you will be able to do just lift little more. Just today's task, make your hand to lift till 25-degree. So these kind of suggestions that AI model can give to the patients. So it will be the dynamic VR application where the AI take the decisions, encourage the patients based on their patients health history, where it can suggest where this kind of simple AI feature can be added with this particular VR application. If you take the AR, as I told you, like let's take some other scenario. Let's take this patient education. Consider there is the AR application where it will take the scan or X-ray reports as input, where it will create the 3D model based on the images has been given, and it is getting superimposed on the real body. This is the simple AR application. But imagine like we added the AI model with this application where the model about let's take only the heart-based education. So where the AI model has all the heart-based data that has been preloaded, pre-trained, where it is going to match the current health history of the particular patient, where it compared with the existing data in their model, where it will suggest your heart looks like something like this, the functionality of your heart is something like this. If your heart is something like this, it may cause some kind of problem, something like this. Or if you take this kind of diets, or if you properly take the medicine, this particular disease will get cure. Many of the patients has been get cure who is already having same kind of scenarios in their health, where the AI model, AI feature of that particular application will suggest the patients. So where it will be helpful, where the people can realize like the application itself providing lots of inputs to get cure from the diseases. So these are all the two simple examples that I can give right now based on the slides what I have. So right now, see, we have three different technologies over here: augmented reality, virtual reality, and then AI. All these three technologies has huge internal things. So it's a very big tech, but we can build a very small portions of each and every application, every technology, and we can integrate it together. This integration plays a major thing, many of the people are getting stuck with kind of integrating multiple technologies together. Like if we see, some people are very good in AR application development, some kind of people are having the good knowledge on VR app development, some kind of people having the good knowledge on AI model training or AI model development. But if you want to integrate all together, definitely the people will get messed up. So where we will be help, we can help on this particular area because we are strong in the integration of all these kind of technology. So this is how we can integrate AR, VR, and AI in healthcare, uh, where it will be make the complete healthcare sector into the different dimension. So with this, I just wanted to conclude my session. So I have given so many inputs with AR and VR, and as well as I have given very few on AA because if I talk about AA, it is getting bored because I'm seeing like you guys are having experience on work with AA, or you have come across so many webinars. I have just explained with two different scenarios how, if we added the AA with these two scenarios, how it is going to helpful. So I just given that input to you. Right now, I'm open for any questions, and then I feel so happy to answer all your questions. Yes, so Dr. Manigandan sir, you have mentioned in the chat box, before the critical treatment operation, we can use AR, VR to ensure the correctness. Of course, even instead of AR, where VR will help to get the to get trained actually, where without doing any mistake, they can reoperate again and again so that they will get practice. Of course. Meta AI and Google Assistant. Okay. So Meta AI and Google Assistant kind of AI model that we can also integrate with AR and VR applications as well. Actually, if you have a time, I'll be able to help you to build the make you to give the hands-on training to build AI powered AR and VR application as well. So not sure when it is possible. But if anything is possible in future, definitely I'm ready to provide the hands-on training to all of you to build the AI powered AR and VR application. Not only on healthcare, if you want, we can also build the education applications as well. So I'm open for the questions. Anyway, I'm seeing the responses. Thank you so much. So if you have any questions, I'm ready to answer. So participants, any questions?
I request the participant, if you have any queries, you can directly ask the resource person.
So any questions, or you can also chat in the chat box if you're not able to talk.
Good afternoon, sir. I am Lakshmi.
Yes, ma'am. Tell me, ma'am.
So can you suggest some real-time data sets for IOMT-based environments? Because my research is based on IOMT environments, sir. So can you suggest some real-time data set? It should be useful for my research work.
So let me check, ma'am. Surely I will. You have my contact number. You just message me. I will check and then I will give you some kind of data sets because mostly I am working on education-based VR and AR applications. So right, so I have this kind of data, but regarding this IoT kind of data, I have to check and then I have to suggest you. So let me check and then surely I will let you know, ma'am.
Okay, sir. Thank you, sir.
Thank you, ma'am.
Thank you. Wonderful presentation, sir.
Thank you, ma'am. Thank you. So, Yuvraj sir, anything else, sir?
Yes, sir. Hey, participant, if you have any queries, kindly unmute yourself and ask the resource person. So I think no questions from participant side. Shall we close the session, sir?
Yeah, sir, sure. So, I have added my LinkedIn ID in the chat box so you can connect with me easily. So, I'm very much active on LinkedIn, so you can also interact with me.
என்ன பண்ணும் 9:30 ஜிமா ஓகே தேங்க் யூ சரி சார்
So thank you very much, sir. Answering, sir.
Thank you, sir.
Thank
Yeah,
you
sir.
very much for your informative session and also you shown some demo on the AR and VR. It's very useful to the participants. Thank you very much, sir.
Thank you so much, sir.
Thank you. You can leave the sir. You can leave the link, sir.
Oh, okay, sir. Thank you all. Thank you so much. Thanks for your time. Nice to connect with you all.
Recording stopped.
தேங்க் யூ சார் தேங்க் யூ சார்
Dear participants, the next session will be started at 3:30 p.m. So stay on the
Sir, is it audible, sir? Ravindran, sir?
Yes, sir. Sir, can you, sir, good afternoon, all of you, sir. Sir,
Good afternoon,
is it
sir. Good
audible?
afternoon.
Sir, welcome you, sir. Ravindra Kumar, sir. We
Okay,
will
sir.
start within 5 minutes, sir.
Okay, sir. Okay. Thank you. Sir, are you able to see the screen, sir?
Yes, sir. Yes, sir. So, yes, sir. Just a small intro, sir.
Recording in progress.
Dr. S. Ravindran sir, Ravindran Kumar sir.
Yes, sir.
So shall we start the session now, sir?
Yes, sir. Yes, sir.
I request Dr. T. Yuvaraja to give you a short intro about today's session. Resource person.
Good afternoon to all. It gives me immense pleasure to introduce our eminent resource person of this session, Dr. S. Ravindran Kumar, founder and director of IRRD Automations, Karur, Tamil Nadu. He completed his bachelor's degree in Coimbatore Institute of Technology in the era in Electronics and Communication Engineering in the year of 2003. And completed MTech in NIT Calicut in the domain of Electronics Design and Technology in the year 2008. He completed his PhD in Anna University in the field of biomedical signal processing in the year of 2017. So he having more than 20 years of experience. He published 26 journals and presented conference 42. He published books, two books, and he also invited for resource person for FDPs, seminar, workshop, more than 27. He also having the funded research activities. He received 41 lakhs from DST in 2024 and 19.9 lakhs from AACD in 2024 and 5.1 crores for from DRDO in 2023 and he received 21 lakhs from DST in 2022. So he has more than a decade of technical experience in physical design and verification of aggressive silicon on chips in advanced nodes like 32 nanometer, 14 nanometer, 10 nanometer, 7 nanometer, CMOS, FinFET, and GNR devices. He is a project manager technical lead for asset design using FinFET devices with back-end development synapses. He is a technical lead for electronics and control unit in green car development for Tata Motors. And also a technical lead for DST funded project on embedded system for Axisar air conditioning system funded by Texas Instruments, Bangalore. He is a consultant for exoskeleton system development and also he doing the development of AI stack for MRI analysis. So today we are truly privileged to have him with us to share his expertise and insights. We warmly welcome Dr. Ravindran Kumar to deliver this session. Please, sir.
So thank you, sir. Thank you so much. So I take the privilege to thank the management of Kongunadu College of Engineering and Technology and the Department of Electronics and Communication Engineering to giving an opportunity to be a part of this FDP, next generation medical automation, the role of AI and IoMT for various healthcare systems. And good evening to all the participants and all the faculty members, students and research scholars. So today my topic is about the applications of robotics in medical automation. So the goal of any medical robot is not to replace the physician, but it has to provide superpower and vision, precision, and endurance. So the main goal of developing a robotics, especially in the medical field, is not about replacing the involvement of a human being. So it can be a doctor or nurse or any lab technician or support person, but it has to provide the an enhancement in the three main things. So one is in any biomedical system, we always categorize into three things. One is the screening, second one is the diagnosis, third one is the therapy. So screening is the first part of any biomedical system where the disease or anything has to be found. So it is a screening method. So for the screening method, we might be using different methods, a way of non-electrical parameters, or it can be any electrical parameters like ECG, EMG, EEG, or it can be any image processing. So it can have different type of inputs for providing the screening process. The next is the diagnosis process. So today in the advanced field of artificial intelligence, the diagnosis has improved a lot. So we have a diagnosis system where any disease or any problem with the patients can be diagnosed properly. So that is the second one. The third one is the final one is this providing the therapy. So the robot will not plays 100% role in the screening, diagnosis, and therapy because without the help of an experienced personality, we can't able to do that. Even though robotics can do computations, artificial intelligence can do computation in a better way, a faster way than a human being, but it's required for any biomedical system. So it's going to be a supporting element where we provide an enhanced vision, precision, and endurance. So medical robotics. The medical robotics is about the robotic system and automation technology, which can able to assist the professionals in diagnosis, treatment, or patient care. And it has a wide range of application from the high precision surgical assistant to autonomous hospital logistics and rehabilitation aids. So any medical system, we have the screening process, and next is the surgical process where it can be a removal of any cancer or tumor cells, or it can be any type of surgical thing. So next is that it provides a support to logistics, and next is the rehabilitation aid. So that is the main role of any medical robot or any automation. So the evolution of medical robots, it has evolved uh, since 1985. Still before that there were machines. But after 1985, we could be able to see that the robotic was playing an important role in the radiological equipment like CT, MRI, etc. So they have been playing a role in those analysis of images by using any radiological equipment. Then by the end of 2000, when endoscopy become more familiar for the diagnosis and identification of a problem with any stomach related, intestine related problem. So that has been evolved in the year of 2000. So next decade, we could able to see that the exoskeleton becoming a plays a very important role because now, so those years we can call it as the year of rehabilitation. Even though rehabilitation has been a general word which is coined for different areas throughout the from the last 100 years, the rehabilitation was there. More than 100 years, even for 1,000 years, rehabilitation was there. So we have in rehabilitation, we have both physical and functional, and we have the cognitive analysis and psychological analysis. So psychological analysis were there in the human race for more than 10,000 years. So that is also a one way of rehabilitation. But when electronics came into a role, the rehabilitation take a little bit more quickness in the medical field, and we see that in the after 2010 we could able to see that rehabilitation were playing a very important role in the physical rehabilitation. Okay, so physical disabilities, etc., can be able to cured in those decade. So next comes the year where we are right now, where we can able to see that since everyone are familiar with all the artificial intelligence tools, so we started with the general machine learning, and next we moved into deep learning systems where we use neural networks. Then we used neuromorphic system, and today we are start talking about the quantum computing, where we can able to do multiple data analysis and multiple results can be done with a fraction of second. So as the evolution, if you see that the robotics played a very important role in both the functional and physical needs of the human race and for any ailment. So if you see the type of robotics, so we can able to see two types mainly. The one is the interventional and another one is the assistive and service one. So if you see the interventional robotics, So it has playing a role in the clinical procedures where it assists the physician, and it has been a part of more precise a surgical process, biopsy and endoscopy, those things. And when it comes to the assistive services, the robots play an important role in the rehabilitation of physical disabilities and the logistic delivery process. And it also perform the disinfectant examples where during the COVID time, so most of the robotic system was developed for the disinfectant where human cannot do those things. So as if you see the evolution of medical robots, it's been a long gap. It's a long period of time it has evolved. But today we have the cognitive analysis, which are machine made, and virtual reality, artificial reality have come, augmentations have come. So in augmentation, also it comes under it's an automation only, like speech augmentation are there. Vision augmentations. So there are several way the robotics has been evolved, automation has been evolved in the medical robot. So mainly, if you classify into four important things, first is for the surgery, how it plays an application of this robotics. Firstly, in the surgery, where laparoscopy, neurosurgery, and orthopedics have been the part of those things during the surgical process. So next is the rehabilitation, where exoskeletons, foot braces, splints were designed. Therapeutic robots has been designed, and especially for the spinal cord injury, SCA, those things recovery, we use rehabilitation. And next is the logistics, where autonomous robots has been used for the transportation of any goods or etc. So drugs, meals, etc. Though that's what used for logistics. And finally is the hygiene, where the UV-C disinfectant robots has been very familiar during the period of COVID times. So it has been used to sanitize an hospital or any room or any place where large number of people are gathering. So these are the four main applications of robotics. And apart from that, as I said earlier, that some of the very important thing is that what we have currently in the market. Okay, so for example, the xenon UV light product, which is used to destroy the pathogens and the superbugs, even for also within a few minutes of time, we can able to disinfect a complete room. So as I said, the logistics where the robots can be play a very important role during the corridors, and it can able to deliver medicines and supplies. And we have the next important thing is therapeutic care. That is comes under the third category, where the robot plays can be important role with the interactions with patients, like patients suffering from dementia, etc. Those who have a problem with their cognitive skill analysis, the robot can play a very important. So if you see the global market about the segment, 65% of the robot automation has been constituting towards the surgical robots, and rehabilitation at 20%, and the pharmacy automation, that is 10%, and service and logistics, that stands for 5%. So if we see in the recent years, the surgical robotics that has been very less companies are focusing, and because the reason is the cost of the product is very high. And since several people here have joined from different colleges and industries who are working in this type of field, so developing a surgical robot is a very very difficult task in our lab environment and in college or our industry. So we have been doing just buying those equipments and they're selling it. But if you go for the rehabilitation, even though a lot of companies have come in India, and they have been developing those products. And if you see the rehabilitation, this is the way, this is the place where every faculty members, research scholars, everyone, even industries in India can able to focus, and those things can be even done in the our own laboratory, college laboratory, and other things. So rehabilitation. So here in my presentation, I will be focusing on the rehabilitation, how these things can be done in our house itself. That is our research labs, etc. We can do that rehabilitation. So next is the pharmacy automation, service logistics. Those are also machines which are being have they do computations are very important in those devices, but they are just provide a taking a material or object from one place to the other place. So that is the thing. So we'll be focusing today main on the rehabilitation. So if you see the surgical robotics, so it's one this we have the minimally invasive method where robot surgery, which has been used to provide a less complex procedures. So we call it as a keyboard surgery. Laparoscopy is one of the very example for that. And next is the surgeon control, which is as I said earlier itself, 100% of a robot can do the process, but still it has to be controlled by the surgeon because um, it's very complex systems like tumor or prostate cancer, etc. So there are several surgeries happening, the intestine cancers. So several surgical procedures are very complex, and even though the robot has all the ability to do them, but still need the help of the surgeon, and surgeon is have a control over it. So that is the a very important thing about the robotics when involved for the surgery. So next is the robotics used in orthopedic applications. So in orthopedic applications, we need a lot of computation in it. So if you see the in orthopedic applications, there are several physical problems with the patient. For example, if you take orthopedic applications, there is a different problems with the age group also. For example, if you take the children's girl children's, so girl children's at a lower age group, if you see that they are suffering from the spinal bend, we call it as a scoliosis. And now currently we see that any orthopedic not only discuss about the problem with the bone, but also it's been combining with the neuron and muscle. So normally any orthopedic problems has to be addressed as a neuromuscular system only. We can't take orthopedic separately as a only bone alone. But in any orthopedic design, product design, so for three things, the screening, diagnosis, and therapy, we have to consider how the neuron system and muscle system plays an important role along with this skeletal system. So normally an orthopedic application is always considered as a neuromuscular skeletal system. But sometimes some cases, sometimes we make mistakes that if we take orthopedics, it's only about skeletal system. That is the sometimes we do those mistakes, but it's not like that. Whenever we perform any orthopedic related robotic design, it's not only skeletal system, we have to consider the neuron system and the muscular system. So that's what all orthopedic application has to be addressed as a neuromuscular skeletal system. So that's what in any orthopedic application we can able to see EEG plays a very important role, where electroencephalogram is used to read the neurosignals. And if we can see that electromyogram signals, where it's used to analyze the muscle activities. So these two is very important for any system to analyze the skeletal performance of a human being. So this system has like the Striker Mako, which uses a CT scan based 3D modeling, a surgical method. So here the case we have the haptic feedback, a robot arm, which provides the surgeon to perform the surgery with the pre-planned boundaries. Okay, so because that is very important, because the diseased bone has to be removed, preserving the healthy tissues. So we have the surgeon has to consider that this is very important because the reason is we can able to understand or analyze the nerve endings in the bone. Okay, so what are the nerve endings in the bone? And another very important thing is that the blood is being generated in the bone marrow. So the thing is that from the blood is being generated from the bone marrow. So if we are performing a surgery on the bone, so there should be a careful analysis on the neuron system and the muscular system. It's not a robot alone. So there is a biomedical signal processing has to be intuitively involved in it, so that the any robot can perform its function properly. So that's what these robots has come up with CT, MRI, etc. MRI and surgery will not go together because the complexity of the MRI system. But the scan can be used it. And currently we have 3D mapping where the images of the MRI or CT can be converted into three-dimensional images of the bone. That is a requirement. If we see the comparison of the robotic with traditional surgery, so any traditional methods, we are very familiar with the traditional open surgery methods where the surgical procedures involves the cutting of the skin with a larger length, while for the robotic, we make a small hole. That's what its name itself is called a keyhole surgery. So less than 1 centimeter. And blood loss is minimal during the robotic assisted system, while for traditional open surgery, it is very moderate. So for the hospital stay, for the robotic system, people normally get cured not before a day. And for the recovery time also is very quick for the robotic assistive system, but the cost is very higher. But the diagnosis and therapy is better. So that's the thing we have to consider. So for the pharmacy automation, just it's a robot which used to dispense the system. So medication storage and package and retrieval. So it's just it can able to store the data of all the medicines, the combinations, etc. For example, antibiotic comes up for every infections. We may have viral infections. We may any other environmental infections like that. There are so many infections are available. So so many medicines are there with different combinations. So those combinations and all should be properly. That's what all the automation system comes up with an artificial intelligence to store all the data. So it's in the conventionally the barcode scanning system is used and the right drug is being placed at the right place. So it's just an inventory automated robot which is used for the inventory control, storage of the drug, maintenance of the room where the drug is being stored. So those things can be done by the pharmacy. Next is the disinfectant robot. That is the UVC light, the Xenex light strike. This is one of the thing where this can be done in our laboratory itself. Okay, so normally only thing is we have to get the UV C light. Okay, those bulbs are required, and these bulbs has a power to disinfectant bacteria and virus during the COVID time. So SARS COVID versions has been available, and those versions can be disinfected by this thing. So normally, when manually 45 minutes are required during COVID time, manual disinfectant process has been done. So several things has been performed in the hospital, but still these machines can able to disinfectant a room within a 5 minute time. So there's a very quick way of disinfectant a room when we find that there is a problem in the room with due to some bacteria or virus or any patient have stayed there. So during the large crowd like railway stations and airports, etc. So this is where the closed environment is there. So when closed environment is there, there is a so normally the immunity is very less, and there is a chance for the pandemic being spread in a quick way. So these machines can help in that. These machines can be developed in our campuses or industry itself. Even a research scholar can take this as a project for that. So hospital logistic delivery system where the delivery system can have different technologies. So it can integrate different technology like artificial intelligence, and there are several sensors has been available. Okay, for the machine, and it has a safe transportation design for the room. So and next thing is it has been automized. Now we see that all the delivery systems has been come up with IoT control also. So this helps to free up the nurses time to be spending on the patients, even though that is required. Even that is required. Not 100% of the time is not eliminated. So only the thing is that the machines can be used to deliver the drugs to the nurses or anyone. So that is the one of this application where this robot has been used. Some currently available robots are available in the market. So next is the telepresence in the healthcare system, where we can see that. So normally in settings like India, where we see that we call it as the primary health center. So in Tamil we call it as the Aramba Sugadara Nilayam. So we find that everywhere. So those things, in Tamil we call it as the Aramba Sugadara Nilayam, which has been there. The primary health centers has been available in most of the villages, and we find that there will be two people out there, and they will be performing all the vaccines and etc. So since India, where maximally people are living in rural area, so a telepresence system can be able to install in those places. So that is one of the proposals, like DST or ACT faculty members can submit, and we are also becoming a consultant partner or co-PA in your proposals, where we can able to be joined together for any type of things. We have done it for the UVC mission. We have done once. So currently we're working with Exos. So even if faculty members who are interested, we have our mail ID. You can get from the coordinators of this FDP, and you can contact us so we can become a OPA for your proposals, which you can submit that. So one of the requirement today India needs, even in the hackathons also, we could able to see some problems on this. So this is the requirement of the day. So we need a telemedicine system, okay, in the rural area where doctors cannot reach there, because now we can see that. So now the college where present, our Kongunadu College, or I am here in Karur, we see that we are the here we can able to sign that the rural areas are more. So where the transportation facility is very less. So we can come up with a solution for that of installation of a telemedicine system, the primary health centers, the Aramba Sugadara Nilayam, so that the people will get benefited from that. So we can come up with very preliminary examinations like electrocardiogram and EEG also. So currently EEG machines are available at very high cost, and we can come up with proposals where EEG machines can be implemented with the cost of less than 5 rupees. So we can't say that EEG electrode is there, instrumentation amplifier and data acquisition unit is there. We can develop a EEG machine for 1 lakh rupee. No, that won't be a such quality one. So we have to go with a little bit of high end DAC units, some national instruments, or we can come up with any FPGA kits which can able to analyze more analog signals. So we can come up with machines. Okay. So we can able to develop a system where we can able to analyze the basic, because currently we see that people are suffering from cardiac problem more today. So diabetes, that is very common problem, one of the problem, diabetes. But the other main problem currently we are facing is that due to the food habits, we can see that there is a lot of cardio problem. So an EEG machine becomes a mandatory in every hospital. Madam, can you mute, madam? Thank you. So that is one of the cardiac problem currently we are facing. So we can come up with that solution, and we see that in currently the food habits by which the intake of calcium has come down. The intake of calcium has come down. Now we are focusing more on the carbohydrates. So the calcium content has come down. the protein intake has come down, and we are facing a very problem with the growth of the children. So we see children with underdevelopment, and uh, the pregnant mothers are also facing these problems. So the pregnant mothers are not healthy means we are in a situation where unhealthy children will be there. So this has to be addressed. So we can't say that we are just an engineers. We are developing an healthcare system with telemedicine or AI, etc. We have to consider the facts, where we are living, what is the requirement of the rural system. So we can come up with the monitoring system for the health base. And today we are having a lot of problem with the skeletal system also, because due to the less intake of protein and calcium, we have a problem with the collagen formation. So obviously the development of the bones gets affected, because the bone development will be up till only the age of 21. After 21, there won't be any bone development. So what is the thing is that the bone development has to be taken care from the childbirth. And if you see that when you talk about these telemedicine projects or rehabilitation projects, these has to be considered in the first degree. So the patient was coming from the rural area. So that's what we need. Expert consultations is required. MBBS is not sufficient, but still the doctor has to have a idea or a vision towards changing the rural arena. So that's a very good project. Family members can come up with a product for primary health centers. So a low-cost product for multi-parameter analysis can be combining ECG, EEG, etc. So that is one of the best example. And how can I able to develop an ultrasound machine? So ultrasound machines, we know that the transmitter and receiver is very high cost, which comes under nearly 4 lakhs to 5 lakhs rupee. But we can able to develop, come up with the proposal for ultrasound machine for a primary health center at the cost of 10 to 15 lakhs. That's possible. The telemedicine system, where we use that with the concept called the PACS, a picture archiving and communication system, where that can be integrated with the telemedicine, and electronics will play a very important role, and biomedical engineering, and everything has been combined. We can able to provide a very good care to the rural people. So next is the laboratory automation, and we are also familiar with that, with the laboratory automation. We have seen several things in 3D machines and all, which performs the process itself. So this is one of the example where when we are using biohazardous materials. So yeah, laboratory automation is another example, and many examples are the 3D printers today we are using. And we have biocompatible 3D printers also available. Some of the campuses, they have the bio 3D printers, where we can able to develop prosthetic arms or prosthetics. So now I like to focus on more on the rehabilitation. Okay. So out of these 4 applications, surgery, rehabilitation, and pharmacy automation, etc. So today I'm going to focus mainly on the rehabilitation, because these products currently, even though they play 20% of the product in the world, but it will keep on increasing. So traditional physical therapy normally relies on the involvement of the manual labors therapist, and it's very effective. But still, we need more robotic therapies, so that some of the treatments which has repetitive activities, the manual labor will get little bit tired with those things. So, but a robot can able to do the same repetitive process continuously. As you see in image, I was suffering from kind of a spinal cord injury or anything, you can't able to move his leg or arm. So that is a repetitive process where the patient has to keep on walking, and the robot should be always on and off, and it has to perform the process. So this is a general theory, but we will see it in detail how these things. So by using a robot therapy, we can do rehabilitation process in an effective way. So next is the rehabilitation with the mobility. So not only rehabilitation, so we can able to make longer of the spinal cord injury. A person can able to stand up, walk, turn, and even climb stairs. So some of the example products available in the market like Reebok or Exo. So those products, if we see the cost is about 10,000 rupee, but 10 lakhs rupee. But if this is also a proposal from the faculty members or from a college and industry consultancy, this can be taken up. So this is one of the very good area where now currently the cognitive also has been integrated. So now the exoskeleton not only comes up just a physical movement rehabilitation, but it also comes with the cognitive analysis also. So, it has a repetitive process, and we have the neuroplasticity and the neural pathway. That's what I said, that we should not consider the skeletal system not only as an example for skeletal. It has to be always considered with the neural and muscle thing. So these three has to be combined together. And as he said that the health benefits. Now the question is that whether we are eating the calcium and protein the level required daily. That is always a question. Next thing is our children or ourselves whether we have a proper bowel movement. It's not only for us who are suffering from spinal cord injury. Whether we have a bowel movement properly daily in the morning. Next thing is whether our bone density, whether our bones are very strong, whether we are taking more calcium intake. So if we see that developing a product for rehabilitation considers what are the health factors and how physically fit the person is, and what is this? That's what we have. We have a measure called bone mineral density, so BMD, where we can able to analyze the different minerals in the human body, and especially the calcium. And obviously, the sodium is a very important requirement for the physical activity of a human being. So all these consideration into it, how this rehabilitation can able to help in these factors, whether the bone density not only provide but the food in long hours, how unnecessary fats should. So these consideration, so that these things. So sensors understand how this function. The neuroplasticity main point is that who have a accident, especially the spinal cord injury is is a key example. If you see that when a person is affected with a spinal cord injury or any accident, obviously there is his cognitive skills has been affected. So when a cognitive skills has been affected, is that now not only the physical damage happened and the patient has to be recovered, but also his cognitive skills. So now the challenge lies not only on the physical rehabilitation, but the cognitive rehabilitation is also required. So we need a repetitive stimulation of the neural paths so that he can able to recover from the cognitive skills he have lost. And next is that how the patient can able to perform all the passive functions also. Okay, passive function, even though we consider it as a passive functions as less involved, but what is very important is that the patient can able to think about the problem he is facing, whether he can able to move the muscles, etc. So that's what this automation involves more neurosystem. So not unlike other automation systems in electrical or robotics or car. Now biomedical is something different where The automation involves more neurostructures. That is that we call it as the cognitive. So let us consider with the case study. So understand a little bit about the robotic automation. Okay, so I will take an example for a case study about the exoskeleton design. Spinal cord injury. So to be a definition, a conventional way always representing something with definition. Wearable, it's a wearable electromechanical device. It helps. Augment means it supports. And also it restores the functions which a human have been missed. So the functions is obviously the physical function. So if you see the spinal cord injury patients, now the objective of the exoskeleton, the problems patient able to is functions. So the main objective of this project or proposal or is to restore the human's functions, physical functions. First thing. Next, is there any question about problem with the cognitive skills? So how the cognitive skills can be restored? Example that the patient is having better cognitive but is having some physical problem. So still, we have to focus on the cognitive skills also, even though the cognitive skills are right, because the patient has to undergo a process where he has to know how to use the exoskeleton. Okay. Now he has to learn like an engineering student, like how the engineering student learn microprocessor, microcontroller, embedded. Like that, similar way, the patient has to undergo an engineering class. Like that, he has to know how to operate the exoskeleton design. So that is the main challenge with this system. But this system is currently come up with the product which is there in the market, which is the Rehab person 6.0 driven, comes up with the different motors where it helps to make the patient to sit, stand, walk, and different things has been provides, and it has several just to have a balance. So one of the very advanced product made which is available in the market with the price more than 12 lakhs. Price is very, very higher. So now we have in our hand. So everyone is not able to afford. How can we come up with a product? How can we? This is an example of good innovation for a person suffering from an injury or an accident. So the wearable brain system, okay, that helps the patient to recover from their physical problems. So this is one of the good example where the people can be focused. It can be an industry problem or it can be a consultancy project, whatever maybe, where an exoskeleton can be developed for any human problem. That's a little bit about this. So apart from that, we have two main things. One we call it the paraplegia, and next is the tetraplegia. That is called the quadriplegia. That is the partial or loss of the four also. And next is the paraplegia, that is the impairment in the motor or sensation. Now we have to understand that the plegias are not the physical disability. They are not physically disabled. The arm and leg are fine. There is no problem with the physical nature of the organ. Organ is fine. So the organ is not functioning. That is the challenge. So the main objective of this product or proposal or whatever may be, it can be that we have to understand that there is no problem with the physical nature of the organ. Organ is fine. So what is really required is that the actuation, how it can be moved. Yeah, how it can be moved, knee can be moved. How can we provide a full? It's not like amputation. The amputation is a word used where it's a removal of an organ, especially the leg and hand, arm. So that's what we call it as the amputation. So for amputation, we go for prosthetic device. For amputation, we go with the prosthetic device. But for plegias, the organ is available. Our challenge is to make the organ to function, and we are trying it. We can't say that the organ will come back or restore its function. So there is an injury levels which is given by the medical association. There were several levels up there, and what level the patient is affected. Whether we go with the normal physiotherapy treatment, physical activities by which whether the patient can able to recover his function, or shall we go with an exoskeleton where the continuous robot automation can help the patient to walk, stand, etc. It can perform his normal gait function. Gait means how a person can able to locomote, how can a person can move. Okay, so this main challenge is that the organ is there, but that it's not functioning. So how can we come up with the movement of the organ? And not only the movement of the organ, next important thing is the complete body has to be supported. So that is the design focus. Next is the stability, how the patient can able to stand. Okay, so next important problem I like to touch upon here is that another disease is that we call it as the Paget's disease, PAGET, Paget's disease, which I didn't add in the slide, but I like to point that the Paget's disease is that we see that the leg will be bent. We have seen several people among we could able to see these people. Some people will say that it's due to polio effect. Yes, there is a chance, but Paget's disease also during the time of war, etc., due to chemical weapons or anything, the children's born they will be having this plegia or Paget's disease. So especially during those kind, or people living in a place where there are too much of chemicals. So that is a very important problem where the children's born with that. So if that is the case by birth, if children are facing plegia or Paget's disease, it's very, very difficult to regain or restore the functions. But we can try. But anything in the medical field has to be tried. But uh, if you consider the system, what the system will have, so that's the thing we can develop in our laboratories itself. Now, great project which can be done in the campus itself. Now, the exoplanets are very light because it has to be strong. At the same time, it has to carry the weight of the patient. So when a patient has a weight of 70 kg, so weight. Now the thing is that when he walks or climbs in stairs or stairs, the force asserted on the foot is more than his weight. Okay. So now we have to consider as the system has to have a stable motion. So we have to come up with the material, aluminum, carbon, or titanium, costly. We know that. So what is the thing is that what material, first research can be on what material I'm using for this thing. So children's we have some other material, depends upon the age groups and the weight of the patient and their sex. Okay, so it depends. So what type of material we are going to choose, what type of problem, those things comes up before doing the automation, these things to be considered. Next is controller. The controller, now the choice of the controller. Whether the patient has a problem only with the physical movement. He is normal. He is a graduate or he is a normal person. He can able to do mathematical calculation. After the accident, he can do all the analysis. He knows everything else we lost. So now the controller has this role. Now the controller has to run only the motors. And based on the sensors, the controller has to activate the different part of the body. So now the automation has a less involvement from the controller because the reason is the patient's cognitive skills are perfect. Now, the age group. There is a child suffering from either scoliosis or paraplegia. Now we have to come up with the controller which has come up with the design. So where the controller has to do all the function. So now we have to go into artificial intelligence or deep learning, any other methods, any neural network method, or we have here conventionally we are using all these deep methods like CNN, RNN, etc. For like how we do for the image processing, etc. Now all the sensor data has to be taken analyzed by using the controller. So the memory of the controller will increases very, very higher. High-end controllers. Let us go with Texas Instrument. Also done a consultancy project, MSPCS Texas Instrument. Controllers, they are very good. The clock also was above 100 megahertz. So these are the things we have to focus. But in biomedical, the most advantages is that all the biomedical signals, the frequencies are various. Frequencies are below 1 kilohertz. According to the acoustic, so data rate, a normal headset will be needful. That is for the robotic automated health system. That is a very important thing. Is the first how we choose the controller, and we can see the colleges and everywhere people are using Raspberry Pi. So instead of Raspberry Pi, yes, that good works good, no doubt on that. But for conventional prototypes, yes, we can go with that, no problem. But to make a product or a concept with the Texas microprocessor, that is our suggestion. There are several numbers with the MSP series. Go with the STM. According to your choice, you can prefer that because those boards are very good. Because FPGA boards are very costly, and the product cost will go up if you use with any FPGA or ASIC devices. So that is the limit on the controller. In robotic machine, the first is the controller. The controller is chosen based on the age of the patient. The next thing is that the controller also okay, see the screen. Browser. So I'm audible. Okay. So the controller is a very important based on different type of the motors which has been connected with the hip or knee joints, which is going to provide the torque. Now we have to go with the motors which are less weight, and some of the motors which is available currently with exoskeletons. Those motors have a very precise, they provide a precise torque based on whether the patient is standing, walking, etc. So that is an intelligent control of an actuator. That is the required of the from the controller. So this has to have angle 1 degree, 2 degree, etc. Angle is even important with the actuator control. What is the angle in 3 directions, X, Y, Z. 3-dimensional directions are very important to actuate these motors. So the controller has to perform those 3D analysis to be done properly so that the patient can move effectively. So that is the thing. Next is the sensors. Apart from the accelerometer and gyroscope sensors, to find our motion, currently in all cognitive systems, we need of EEG electrodes and EM electrodes. And these electrodes are very important because these electrodes provide what has to be done. For example, the patient cannot has a ability to control the exoskeleton. If that is the case, his thought process to EEG that has to be done in an effective way. So that is what the sensors here plays a very important role, and that is one of the very important thing to be considered before designing the product. So the numbers now little bit and next slide. So first is the level where now we are about cognitive skills. Okay. So now the patient is good enough manual control. He can able to work with joysticks, etc. Now he can able to do control his own exoskeletons. But now the patient has an issue with the movements itself, because whenever in a case like spinal cord injury, not only his thought process has to be converted into a myosignal. That's very important. So he thinks in the brain to move his hand, but those thought process through the neurosignals that has to be converted into a myosignal. But due to the spinal cord injury, this process of converting the thought into a myosignal gets affected. So now we have to go with the help of the either EEG or a EMG signal. That's what we have a human today. So for the most and the EEG signal. It's very difficult to EEG signal. Next is that's extra. Now we have into the upper support. That is as we taken as case study. Now the of challenge has been expanded towards the shoulder and area. The people think that so in the upper limb exoskeleton, the challenge lies on how the shoulder, elbow, and wrist is been moving. So we have the gravity compensation included. There is a functional disability of shoulder and elbow can be corrected. So now it has to be addressed not only as a biomechanical thing. Now we have to consider the other factors also. That is nothing but analyzing the gravity. So this is an example where we see that hand and fine motor skills. Then we have seen that several products available in the market, and we have seen that our students in the campuses are a very small industry projects has been available for small, like some of the hospitals in even in Tamil Nadu or even in CMC Vellore, we can see some of the physiotherapy people are having some products available that for the fine movement of the fingers. People are from different neuro problems. So these are the products which has been used where we can able to make the finger or the patients may have a problem with grasping a material, an object. Okay, where the daily life, okay, daily life process. So this is another example for that. So next important thing about the exoskeleton case study, what we are looking at is that the how we can able to correct the gait analysis. Is anyone working in the gait analysis? Any faculty members? Which there you can put it in the chat box, because this is the area where many people are working. Anyone, if anyone is working in this area, gait analysis. So there is a problem, we call it as the hemiparesis, that is the weakness of one side. Whenever a stroke happens, we call it as the hemiparesis. That is the thing, one side, the patients will have a problem. Now the real challenge is that we have to study the second half of the human body has to taken the analysis and it has to be performed. But this is not possible for all the activities. One thing is that there is a symmetrical gait pattern of a human motion. When a person walks, especially, or runs, we could able to find a symmetrical gait pattern in the human body. Now the real challenge lies on how this gait patterns has to. So that is one of the challenging problems faced, where the product comes up with analyzing the complete picture of how one side of a human body functions in every way, how the neurosystem works, how the muscular system works, etc. And that has to be compensated in the next half of the human body. That exoskeleton should come up with that design. And it has to provide the body weight support also, so that the patient can walk freely. And since one side of the body has been already affected, and that should not affect the muscles. So that is one of the challenge should be. So we have to keep on monitoring the EMG also for this type of product. So there is a skeletal analysis, and the EMG signal also has to be monitored. So the some of the guidelines given before going into the product is that whenever we perform the upper extremity, one thing we have to consider is that there is any problem with the patient on the cardiac problem. Because pressure is a very important parameter. And the pressure depends upon the salt what we are consuming. That is the sodium level. And whether the patient is having a diabetes. So that is what, when we design an exoskeleton, the age becomes a factor. Whether the patient is less than 10 age or 10 to 20, 20 to, because till 20, there is a chance for the bone development. Till 20. For example, a girl child is suffering from a disease, scoliosis. We can't say it as a disease. That is a problem with the spinal cord bending. So it is the spinal cord bending can take shape of a C or shape of an S. So now we have to come up with the product for that child. So we have to develop a scoliosis brace. Now that brace will provide a force or pressure on her body, upper part of the body, the upper extremity. Now what we have to consider is that how the pressure of the patient changes when the pressure is applied on the human body externally, because the pressure applied on the body may affect the cardiac system. Even the patient is having 120/8 better pressure ranges he has, but still there, 120/80, so still there is a problem. So these things to be considered before developing a exoskeleton. Now there is a huge pressure variations with the patient and whether the patient is having a cardiac problem. Now this before developing the upper extremity, now the system has to come up with the unit where the unit has to monitor the pressure of the patient along with the ECG analysis. Now it become not only an exoskeleton with the EMG and EEG, now the exoskeleton has to come up with an ECG system also. The pulse rate has to be monitored. And next thing is an exoskeleton, a little bit of higher weight has been added in the human body. And if the patient is moving to a higher altitude, so now there is a pressure difference. The pressure difference affects the oxygen saturation also. That is the SpO2. That's what we faced during the COVID time. There was so many deaths happened due to the lowering of the SpO2 values. That is the oxygen saturation in the blood. It's good to have 95 or 96 SpO2. So now the system has to come up with those analysis also. Now we can't say that it is just a robotic automation system.
where the robotic automation system can control not only the thing, but the system has to monitor all the the physiological parameters also. That is the electrical parameter. So there comes the guidelines of the heart association or any person before developing the upper limb. So any biomedical automation product to be done in biomedical system, what has to be considered is that whether we are following the rule book. So that is what we call it as the assessment scores, because we are providing therapy, not the diagnosis. Because already the patient is diagnosed that the patient is having a paraplegia, the patient is having a scoliosis, the patient is having a spinal cord injury. So already the patient is diagnosed. Now the challenge is that we are providing the therapy through the robotic automation. The therapy is not allowed to perform just like that. It is not a product like a GPS system for a bus or lorry, or not like that. Even a UV disinfectant, when it is on, humans are not allowed to enter the room. So for any therapy device, what is the challenge when we develop a consultancy product or a product in biomedical system? Only thing is that the rule book is bigger. That's truth. So when the rule book is bigger, we have to go with all the conditions and classes, etc. Accordingly, it has to be developed. So that is what. And very important challenges by the guidebook is that whatever treatment is given to the patient should know about the treatment. That is the rule book says. That's it. But we normally, if a patient asks a doctor that why are you giving me this medicine, the patient has the right to ask, and the doctor has the responsibility to answer that question. But if we ask ourselves, we never ask the doctor what is the medicine is for. They will give only give the medicine in the morning, afternoon, etc. But the rule book says that the patient should be aware of the treatment given to him or her. So the challenge with the biomedical automation system is that for rehabilitation, the patient should be very aware. Not only very aware, he has to be given a training for a long period of time so that he can able to use the product by him or herself. So that is the bigger challenge. So we have to follow the guidelines before doing the product. So these are some of the insight into the rehabilitation automation. Okay. So let us, I will give you certain detail on still a better thing about the spinal cord injury. So spinal cord injury, you can see that the patient, you may think why the patient has to put so many devices around him. Instead of being bedridden for 24 hours sleeping and sitting and activities, I just let him be connected with the device. And it's there we can see that an headset has been connected, and the patient can be able to restore all his functions. That's very important. And very importantly, for example, if we are sitting for a very long period of time without performing any physical activity, for a long period of time, and we know that even for the faculty development program, we are sitting for a very long period of time, that's not visible. So every 1 hour or 2 hours, we have to stand and walk for a small distance, drink water, that's necessary, because that is very important. Then only the required minerals will be absorbed by the bone. Only if the bone is good, the bone marrow will be good. Only if the bone marrow is good, there will be a proper generation of the blood. So this spinal cord injury rehabilitation device helps the patient, not only helps in the walking, it makes my bone to be active. Now the question is that the bone is the information taken to the bone from the brain, the channel, the path has been affected. That is the reason why they can't able to move. So now this machine, by keep on when the patient walks continuously, even it will reactivate their nerves. They will be regaining their skeletal recovery, muscle recovery, and we call as the feeling. Because these patients, even they don't know when they will have a bowel movement or when they will pass the urine. They don't have those feelings. So by using functional electrical stimulation, we have to stimulate the bowel movement and the passage of the urine. So this is very challenging. But when we use a spinal cord injury automation system, rehabilitation automation system, now what happened is the patient not only recovers from the physical activity, but also he recovers from the the emotional, that is the feeling, also the cognitive skills. So for that, we use the brain-machine interface where robotics and the VR virtual reality helps them, because we have to teach them how to activate the product. The next important product, which is available in the market, that is we call it as the Oculus. It's called as a walk again project. Where in the walk again project, the patient is always hooked with the electrodes, 11 electrodes, and these electrodes record their brain activity. So that is a training program with a feedback system where the patient can be able to see where they are walking and what is their footsteps, etc. They can be able to see it. It's like a animated one of his own activity. Okay, it's a self-animated about the patient itself. It's a very advanced system available in the literature, where we call it as a walk again project. So here the case, his own movements has been animated, and the patient can be able to see the feedback of about his motion, because these patients are spinal cord injury. They don't have any feelings in their body. Okay, so but they can think. Their cognitive skills are good. They can able to think. They can do any type of activities, etc. They can do. But only thing is, the signals from the brain will not be taken through the lower part of the, not lower part, the upper extremity also got affected, and lower extremity also got affected. So this is one of the product, and this is also one of the problem, where by using a virtual reality we can able to do the automation of the. So next is the robotic exoskeleton with the muscle. Okay, so here in the case we see that there is an EMG sensor and the position of the EMG sensors. Okay, to understand whether there is a signal is being transmitted or not. Whenever we consider a patient, the challenges are more. All the patients, they don't have a similar problem. Every patient comes up with an unique problems with them. So everything has to be addressed case by case. So this is another case where, yes, we find that there are motions in the human body. There are motions, but there is a problem with the degree of freedom. How they can't able to move. So when we have a good degree of freedom, the patient can able to move their shoulders in either in the flexion or extension way. They can able to move their thing. So now the problem with this patient is that there is some problem due to an accident or a spinal cord injury, where there is no signal transmissions within the body. For example, in the diagram, you can see that there are different EMG signal marked, the 1, 2, 3, 4, 5. So these are the representing different places. Okay, for the triceps or pectoralis major and infraspinatus. So if you see this EMG locations, every EMG locations will be monitored. From that, we can able to see whether the patient is recovering or not. So we place EMG throughout the body. Let us consider this example. This example is that the SEA rehabilitation, where the patient is hooked with the device and he walks, and accordingly his nerves and physical the muscle is get reactivated. Okay. Now we have to verify whether the muscles are got reactivated or it's working. And there is this case where, yes, there is a muscle activation is available. There we can able to find out signals in the human body. We can able to find out the signals available. Now let us ask a question: how doctors or physicians will come up with this conclusion that this patient is suffering from this, that patient is suffering from this? How can they can able to diagnose that? First, anything they will go with the X-ray. First of all, go with an X-ray to understand the skeletal system. There is a physical any damage in the skeletal system. Okay, they found that there are A, B option. So A, B option, A is the normal skeletal system, B is the there is an accident, a breakage, etc. in the skeletal system. So first A is normal. Now there is no use the X-ray what we have taken. There is use, but we couldn't able to diagnose properly. Now let's go with the CT. To check the nerve endings, the nerve which is connected with the skeletal system is functioning properly or not. Next is we have to understand the blood vessels, the soft tissues. So we have to go with the MRI. So there is a stage by stage screening. So first we screen it. First the screening process goes with just a communication. Then the doctor will do the touching process and check whether the patient is normal. Then you go with the X-ray for the analyzing the skeletal system. Then with the CT, then with an MRI. Then they will come to a conclusion that what is the problem with the patient. Now everything is okay, but the patient cannot able to move. So which means that there is a problem with the degree of freedom. He can't able to move it. So now let us come up with a product. The objective is that to make the patient to move. Now we have to analyze all the sensors presented. So it's a very good about the wireless network. So the patient is at the home. Sensors are hooked on him because we can't be putting in hospital and monitor for 24 hours, 365 days. It's not possible. So it is at home. So now it comes the telemedicine is another technology involved here. Wireless sensor networks where we can able to monitor the EMG signal from the remote area. Obviously, IoT comes this includes IoT project. So this is a fascinating project where we need time to understand how the patient is recovering. Okay, so this is an automation, not a one-day automation or two-day process analysis. It takes months, even years, for the patient to recover. And we know case studies around us, our friends, relatives, brothers, sisters, many relatives. We can find there are one or two cases. We find that the people after an accident they have a problem with the movement. And we also have case studies around us where some person, due to the loss in the business, the family, he became paralysis. It's an effect in the cognitive. So an emotional danger, and emotionally is affected. His muscle gets affected. Muscle and nerves get affected. No, physically he's all right, but he got emotionally affected. So that is another case. How that can be recovered? The organ is okay. Now he is affected emotionally. So now here EMG will play a role, but we have to go with the EEG also. So it's a case by case. This thing has to be done. So this is one of the example how what are the different things a product. So for the hip mechanism to analyze the hip. Now always the question arises, why this patient, this looks very hard, a bigger one. How a patient will feel discomfort by connecting this in his body and work like that. We ask a question, but the thing is that we in medical sciences there are so many treatment therapies which will be very discomfort, but it leads to a right treatment. Okay, so these are some of the different thing. You can see that the force sensitive resistors, the insoles comes up with the force sensitive resistors where we have to analyze the load capacity, because the load capacity is very important. So the load force changes for patient to patient. So load analysis we have to make the weight of the human body. Next is the knee mechanism and the joint, angle joint and hip mechanism. So that we can use any type of circuit for that microcontroller. As I said, we have to go with higher end microcontroller, and we see that the frequency range of more than 600, 700 megahertz is enough. 200 for 200, 300 is enough. So we have a stimulator here. The purpose of the stimulator is to provide the excitation to that particular muscle. Okay, so this is one of the therapy robot which is available in the market. Okay, so where the robot can provide the pain. Okay, the pain in the neurons, okay, and it provides the bladder and bowel function, because that is important. Because the patient doesn't have a feeling to pass the urine or bowel, so this provides those things for that. So we have to provide a stimulation function. We call it as functional electrical stimulation. So it's look like a treadmill. So it's look like a treadmill. The patient has to be connected, and this patient, you see that is not completely physically affected. She can able to walk, but only thing is she has a problem with the stability issues. She can't able to stand. Example. So this sort of treadmill products, that is the automations, can help the patient who have the ability to walk, but they have a problem with the stable issues. Okay, the gait issues. So next is the wearable. Now the patient, now the complex part is over. Now we let into a the patient has only minor problems. So these are the products where we can do it in our industry or colleges itself. Okay, like some of the wheelchairs, crutches, everything can be developed. Okay, so it's a personal mobility device. So we can connect also. You can see that there are control devices for the motor or the hip and knees. Okay, so the patient is she or he can able to walk. Okay. So next is the locomotive system. That is one of the most familiar system, which uses the treadmill product. So treadmill comes around nearly 3 to 4 lakhs of rupee. So for consultancy or proposals, we can add that for the treadmill cost plus the the EEG monitoring, EMG monitoring, etc. And you can have a training sessions ranges from 35 to 45 minutes. All the parameters will be measured from his body for the analysis of his regular activities, whether he is performing the regular activities, etc. He can able to perform that. So the hybrid system, as I said, it comes up with the functional electrostimulation. Small electrical pulses will be always given to the paralyzed muscles if even if the so that you can ease the design. Okay, if the exoskeleton cannot able to activate the walking process, mild electrical pulses. So that is that FES module itself is a product. The functional electrical stimulation itself is a product. This electrical stimulation uh, also been used for bowel movement and bladder emptiness. That is means they make the patient to pass the urine or this one bowel. So dual task trainer. So this is the cognitive motor coupling. Now we are getting into the next goal is that how to combine the cognitive skills also. That also available with the Locamat. The Locamat is one of the product you can see in the image where the patient has a the vision augmentation unit fit on his head, so we can able to see the different places where the activities he's performing, etc. It can able to simulate the real world conditions, and the system has to provide the virtual reality as if he's walking on a mountain steps, etc. Okay, that's one of the product available in the market. Very good automation unit for dual task where the person has to do both the physical activity and the cognitive together. Okay, that's what we call it as a dual task. So what are the barriers in all the medical automation? The barriers is that the very limit is that the cost is very, very high. Next thing is training the patient is a very, very challenging one. And the people who are designing a product should know all the therapies, etc. about the product. So future of rehabilitation. So main thing is we can go with the soft exoskeletons instead of having hard metals. Is it possible to have clothes? Okay, that is the future. Next is the brain computer interface. Next is the home robotics. Okay, compact devices which can be done at home. As I said, telehealth monitoring can be added here. Okay, tele rehabilitation. So future trends that we need intelligent robots is required. That's what I said. Soft robotics. Compatible robot. What you call the research of the material, the property to be used in the development of the robot. That can be one type of research problem. Next thing is what type of communications can be used, what type of intelligence, whether we are going to use artificial intelligence, quantum computing, etc. That can be another thing. And what type of computers we are using, that is the embedded systems we are using, etc. So those are the future things. So main future things what I feel the need of the day is that the brain computer interface, that is the one thing where the from the imagination we can able to control the machine. Okay, the cognitive skill, that is one of the open research available. We think to make the robot to function. So it is a EEG signal has to be taken and it has to be analyzed. Okay, so that is one thing. So next is the future is that we are already in the AI world. Already the AI is ruling, but still we can combine augmented reality with that. Augmented reality is that we are replacing a sense organ. Just with an example, if a person, how can we provide a vision to a person who are unable to see? A good augmented example is that the hearing aid. Even though hearing aid is called as an assist device, but still hearing aid also takes that place. How it helps the patient to recover from the sound. Like that, we can combine the future will be about the AI and augmented reality. Obviously, now it's quantum computing combined, because quantum helps the automation robots to think a lot and to come up with the decision as quick as possible. So next is the nano robots. Still, it is in research, and some of the drug delivery system. And we know that any drug comes to the market, it takes more than 10 years. Okay, that's we already know. To any drug, when it comes to the medical shop, it takes nearly 10 years for the process. Okay, to get approval, etc. So obviously, currently the nano robots have started long before. Still, it is in the application, but still research are going on, but we need tools to verify it. Okay, that is another thing, but we could say able to see news that certain nano robots are designed like that. So thank you so much for the opportunity given. This is our contact, my personal contact, and the company. For any outreach, you can contact us. For any consultancy projects, you can combine with us, like proposals, DST proposals, DRDO, etc. We can become a part of your team as a co-PA, and we can submit a proposal. For any events, you can call us. And for product, we are in the product. Once again, for giving me.
Dear participant, do you have any queries? You can ask directly to the resource person by unmuting yourself.
If you have any further queries, you can write to us. We are ready to answer your questions. Any development also, you can contact us through consultancy at irrd@automations.com. You can contact us on any problem or proposals or projects. We can collaborate. If you don't have any questions, thank you so much. Thank you, the Department of EC. Thank you, sir. Thank you, the participants.
Thank you, sir, for informative session on medical robotics and robotics in medical automation. Thank you very much, sir.
Recording stopped.
Dear participant, your attendance has been updated in your Atal portal login. So kindly verify it. Up to yesterday, attendance will be updated in your Atal portal. Today you are having an assessment in the Atal portal only. Before that, you can able to put feedback for the resource person, and the conduction of this program is available in the Atal portal. In order to get the certificate, you want to put the feedback, and then you want to get the minimum marks in that assessment, and also you want to get 80% of attendance. So kindly verify it in the Atal portal. Test procedures and how to open, like that everything should be discussed in the validity session. So, assessment is mandatory to get the certificate. Thank you.
When is the validity session, sir?
6:30, ma'am.
Shall we leave now, sir?
Yeah, you can leave and join, ma'am. The next session will start within 10 minutes, ma'am.
Okay,
5 to
sir. We have to
6:30.
fill the Atal feedback link also by now.
Ma'am, now we are putting the feedback form for the attendance purpose for
Yes,
today's
sir.
attendance. In order to get the certificate, you want to put the feedback in that Atal portal, ma'am. It's available, ma'am.
Okay, sir. Thank you.
Thank you, ma'am.
The timing for making attendance in Atal portal, sir?
Yeah, up to yesterday, already updated, ma'am. You can verify that. Today, we will update very soon. Because the sessions are going now, no. After the completion of 3 sessions, we will update the attendance in the Atal portal, ma'am.
Yes.
Recording in progress.
Bhubri Secretary, sir. Welcome you, sir.
Good evening, sir. Thank you, sir. Thank you.
Short intro, sir.
Yes, sir. Yes, sir.
Good evening to all the participants. It is immense pleasure to welcome you all for final day and final session of our Atal FTP. With great honor, I introduce today's resource person for this session, Mr. Bhubri Secretary, founder and CEO of Prashant Medical Technologies, Coimbatore, Tamil Nadu. Mr. Bhubri Secretary is a biomedical engineer, has completed his Bachelor of Engineering in Biomedical Engineering from the prestigious PSG College of Technology in 2014. He carries extensive professional experience across India and abroad. He has served as product development engineer and a senior technical support engineer in Puducherry and technical specialist trainee in Germany, technical specialist in Abu Dhabi. With an inspiring entrepreneurial vision, he founded Prashant Medical Technologies in 2017. Circuit tester, anesthesia ventilator algorithm, ventilator breathing circuit test jig, venturi test jig, electrical patient bed actuated current measurement test jig, prototype design for oxygen monitor and oxygen conservation device. His dedication to biomedical technology and healthcare safety continues to inspire students, researchers, and industry professionals. We are truly honored to have him with us today. We warmly welcoming Mr. Bhubri Saktivel to this session. Please, sir.
Thank you, sir. So, thank you so much for the invite. So, good evening to everyone. So, first of all, I will take this opportunity to thank the entire management of Coimbatore College of Engineering Technology, so and Department of Electronics and Communication Engineering. So, for this, so Atal sponsors 6 days online FTP. That interesting topic called next generation medical automation, the role of AI and IoMT in transforming healthcare systems. It's a very interesting topic nowadays. So then our topic is emerging technologies for innovation in healthcare. So there are so many emerging technologies as of now in healthcare. So if you take the medical, so in medical we do have so many problem segments. Since I am from medical industry, so if you're asking me, so if you're going to hospital, so for a small fracture, so for taking X-ray, that is one kind of a good technology. So that CT scan is a evolvement of that X-ray, and an MRI, PET scanner, and spect. So these all things are there. But here already we do have this kind of a thing. So but one more thing. So what are problem statement? We can take it from these kind of ideology areas or operation that are critical care. if you are taking only the radiology X-ray machine, I can tell you. So if you are facing any kind of problem, so maybe any accident or fracture or any swelling, so we are visiting hospital. So and we are advised to take the X-ray. So for X-ray for taking X-ray, then we are waiting for 1 hour. And after taking X-ray, so for confirming the problem, then we want to visit the doctor. Then finally one Dr. A is telling, so we want to go for, so I mean, plating or screwing, or another doctor is telling, so it's not a big issue. Simply, then you can take rest for 2 to 3 days, and Dr. C is telling, so then you can go for some oil treatment. So likewise for physiotherapy. So the Dr. A, B, C is coming with different consultation. So then whom to believe? That is where like our problem set is lying. So each and every hospital, I mean doctors are completely depending on biomedical industry. In case like for example, Dr. A is telling one kind of thing, Dr. B is telling another thing, or Dr. C is telling another thing. So to avoid all such things, if you are incorporating the module, AI-based model, so inside that particular machine, that machine itself will tell you so what kind of problem it is, whether it's a fracture or small issue or big issue or anything. So the machine will tell you. Even so, what kind of a medicine you want to take, that is not coming in the. I mean, these kind of things are called emerging technology. So then each and everything is coming in the line. Okay. So I think so. Can I share the slide? Yes, just wait.
Yes, sir, you can share your screen.
Yes, sir. Yes, sir. I will share the complete screen.
Your screen is visible, sir.
Yes, sir. Yes, sir. Just wait a minute, sir.
Entire screen is shared, sir.
Thank you, sir. So this is what our emerging technologies. Emerging technology sense. So before going to start, let me tell you like who we are. So I am Bhubi Saktivel from Sound Technologies. So we do have like R&D and training and product development and sales and service. Also, we are authorized service partner for Schiller Healthcare. So this is our office. We are located in Coimbatore and Salem. And this is our entire coverage of Schiller, like around 25 diseases. We are the one who take care of all Schiller activities. And then our main customers are government and medical hospitals, and private hospital clinics and ambulances. So and then institutions. Okay, let me tell you, this is a very important thing. So like before, so I mean before going to see like what are the emerging technologies in healthcare, that we should know how we traveled so far. So last 200 years or 300 years, how we traveled so far. That is very important. So you see, the Industry 1.0. Industry 1.0 is nothing but, so in 17th century we started with Industry 1.0. That is the environmental industry in healthcare industry, or maybe like commonly considered as a engineering field. So engineering field is coming under the category called STEM, STEM, science, technology, engineering, and mathematics. Science, technology, engineering, mathematics. So this is a wonderful field as of now. So as of now, we are experiencing IoT or big data or machine learning, deep learning, and AI or any kind of thing. So each and everything is designed by these 10 people. So if you are seeing in the industry, so if you are taking any kind of a HR department or accounts department, you see like in HR department earlier like 5 to 10 people will be there in each and every company, but as of now, so 1 or 2 people only like there. So because the entire thing is handled with software, also accounts. So there are so many like software tools are available for tracking the finance management systems like ERP, and then Tally, Joe, books like this. Then so these things completely taking care of that accounts people. So then it is completely replacing those people. But industry, if you take medical industry, then it is as of now. So it is not in the situation to replace, but it is in the situation to assist. Assist. For example, if you are having like AI-based algorithm, it is assisting the doctor and assisting the biomedical engineers or the industry people to come up with the good quality products. So the industry, so that is where like we are coming in the STEM category. Industry 1.0 was there in 17th century. I mean 17th century that time. So before that, that's Industry 1.0 is nothing but it's called steam engine. Steam engine is the first evolvement. Before that, we used animals for transportation, even for taking the water from the well. Then we used animals. But after that, then we are coming up with a solution called steam engine. So that particular steam engine we used almost for 125 years. After 125 years, we started developing electricity, and then voltage, current, power, motors, and fan, lamp, and everything that we start developing slowly. Semiconductor components like the resistor, capacitor, inductor, that is also we started. And finally, like so PC, so we started developing PC. So that is what that industry 2.0. That is called industry 2.0 is called electricity. That was there almost for 73 years. Then again, so the same the industry. I mean, 3.0 was there. So 3.0 is nothing but
As per your syllabus, it is the recommended book. But I don't be covering Unix concept.
so I think somebody is asking.
Sorry, sir.
No
Someone.
problem. No problem, sir. Like industry 3.0 is nothing but like information technology. Information technology means we do have power, we do have electronic components, so we do have control systems and mobile communication. So we were coming up with a solution called information technology. Industry 4.0 is nothing but AI, artificial intelligence. That is what thing we are experiencing right now. That is the emerging technology. After that, so in industry 5.0, in within 2030, so we will be having the technology called cognitive systems. That is a technology, that is the industry. It will change the entire thing. So one more thing we should realize here is called industry 1.0 was there for 125 years, 2.0 was there for 75 years, and then we use that information technology for less than 30 years, and then industry 4.0 less than 10 years. So after the era of the IT technology, that my AI, the technological AI, we were using only for 10 years. Then industry 5.0 is coming. Industry 5.0 is called cognitive systems. Cognitive systems are so cognitive systems are mass customization and cyber physical. That is what thing. So that time is getting down. The technology is changing too fast. So even our grandparents, so if they know how to build a steam engine or they know how to, so I mean they know how to service or commission that steam engine, they would have completed the entire generation. But as of now, it's not like that. So maybe we are the one. So we are the one like the faculties and then students, not only students like the faculties. So when you are you when you are there in the childhood stage and we were not experiencing the mobile phone, we were not experiencing the TV. So after that, slowly we were experiencing the mobile phone, keypad phone and then touch phone and slowly PC and then 2G, 3G and then 5G communications and then we are at the same era like we are experiencing AI, IoT, IoT, everything we are experiencing. The same way the technology you see like our generation is experiencing our generation how much technology we are experiencing. Industry 5.0 then this is an advanced level like cognitive system. So if you take Apple iPod, AirPod. So before earlier we were having so normal wired headset. So everything you can control by using wired headset. But right now, so we do have like Bluetooth headset. And the same Apple right now is having one more pattern. So you don't want to take your finger to increase the volume, decrease the volume, or alter the call through that AirPod. Simply what you can do like so the Apple is coming up with the algorithm called so inbuilt so AI recognition system. So if you are getting some call from your friend, automatically that AirPod will recognize so whether your brain is liking that call or not liking that call. If it is not liking, then automatically it will be cancelled. Automatically it will be cancelled. That is what the thing. So it's coming. So also like it is simply wherever the repetitive tasks are happening, simply it is replacing those tasks by using the AI. So that is what the thing is happening. So as of now, so we should not stop learning. If you know a camera system, we should not stop. Again, we should learn. So how to use camera system for our application, or how to use AI, or how to use IoT or IoT like this. Then we want to like so we should go in a different level. So as of now in industry, so 4.0 we are experiencing these things like called augmented reality, system integration, and then cloud computing, big data, and IoT, 3D printing, cybersecurity, autonomous robots, and simulation. So all these things we are experiencing right now. So that is what industry 4.0. So augmented reality, if you take augmented reality, then you can ask me, sir, what is the purpose of augmented reality? Simply we are doing it for the gaming purpose. But as of now, you see, when you are visiting a hospital, earlier doctor was telling him orally, so you are having fever, or you are having heart attack, so or you are having like arthritis, then we are going to come up with a knee replacement like this. That is called old method. But slowly, like when doctor is showing image in the PC, then as of now, doctor is showing the video. So this is what the problem we have. So we are going to operate like this. But the same by using the augmented reality. So by taking the images from the CT scan and MRI scan, simply you can put it in the model. Like when the patient is wears that, the glass, so the reality. So the patient itself can see their own reality, like what is happening inside the body, then they can see in a three-dimensional image. That is the importance of augmented reality. System derivation. As of now, the system derivation is, you can see. So we are incorporating this. So we are incorporating this. Integration, like, so AI based integration, IoT based integration, communication based integration in machines and each and everything. That is called simulation cloud computing. All these data we are transferring into, like, all hospital data and then industry data. We are simply communicating, transferring to the cloud. So from there we are processing and then big data. That is called, we are collecting more number of data in the cloud. And big data. Big data means, so we are for research and all such things, and we do have so many data right now. So that you want to analyze means, then we do have so many tools like R programming or Python, or many tools are available. That's called big data. And then IoT. So Internet of Things. Internet of Things is nothing but, so simply you can communicate so through internet. So either it's the Wi-Fi or maybe 2G, 3G, 4G or any kind of network like that, you can simply communicate. So one device to another device. If doctors in the US or the patients in Coimbatore or Salem or Chennai, like from here, then we can communicate or we can send the data to the particular that doctor who is sitting in US. From there, the doctor can consult. That is what IoT. 3D printing. 3D printing is one kind of emerging technology. Already is emerged for all kind of additive manufacturing. Then 3D printing is working well. Also, one more thing is coming, that is called so bioprinting. So same like 3D printing, one more thing is coming, that is called bioprinting. So bioprinting is nothing but, so simply if you want to do mimics our own tissue, so heart, lung, this kind of tissue mix, that time we will use this 3D printing. Bioprinting, cyber security. So because of this AI, automatically the cyber security is improving. Autonomous robots, mobile robots is coming. So each and every way. So if you want to transfer one thing to another thing, one thing to one from one place to another place, then you can use mobile robots for industry purpose, pallet moving, or warehouse maintenance, or inside of ICU and operation, that or maybe like any kind of fire safety areas, and those areas are autonomous robots are functioning. That is one kind of a thing. Simulation. So instead of going for the hardware, everything we can try to everything we can try to manage with simulation part. That is what, so we are experiencing right now in industry 4.0. So then next is called, so what are the, what are the difference in industry 1.5? So as of now we are experiencing so many things in industry 5.0 that concern, most of the thing focusing on delivering customer experience. Customer experience means earlier than we were connecting machines and we were supplying and we are concentrating on sales. That is what thing happening earlier. But as of now, focus on delivering customer experience. The customer wants to experience more thing. That is what the thing. And hyper customization. If Dr. A wants something, Dr. B wants something, or customer A, B, C, or anyone wants anything in the particular configuration, then we can able to manufacture it right now. That is what Industry 5.0. And responsible distributed supply chain. This is kind of thing we will follow in industry, like supply chain. How we can take the machine to the customer, or if even if you are taking any kind of blood sample, how that sample can be taken and how it can be collected, how it can be packed, and how it can be sent to the particular laboratory, how it can be processed, and how effectively and how safely, like you can again take, dispose of the blood, and how we can take out the report, how we can project the report to the doctor or the clients. That is called responsible distributed supply chain. Everyone can see. So just see earlier. So if you are sending something, one courier from one place to another place, until and otherwise still receiving, that we are not knowing that where the like package is available. But as of now, like, tracking is available. The same way, responsible distributed supply chain also is one kind of technology in industry. And then experience activated and interactive products. Everywhere activating, like, so we do have touch screen. So we will have, so then you can transfer, you can communicate the data with machines, even by talking, by clicking, by sending, like all these things are available. That is called experience activity products and return of manpower to factories. So if you want to return something to the factory, factories such as earlier, as of now, the people are going out of the factory, but return of manpower to the factories means that by involving that manpower in the same factory, so we are trying to come up with effective solution. For example, 100 manpowers are there. Then as of now, then what is the technology we are coming up? So it's not to reduce the 100 manpower to the 50 people. So we are trying to increase the productivity of the same 100 people, which means then if you want to increase the people 100 to 500 to increase the volume or to increase the productivity, so we are not increasing, but the same 100, so how we can increase the productivity? That is what the return on manpower of factories. So because of these things, medical device, since we are from medical device, so we do have that fear. Will robot and AI take my job in future? Of course, so AI and robots will take our job in future because as of now, so the main competitor is not your colleague or your friend or maybe like your co-worker. Our main competitor is our AI and the robots. So as a faculty, since it is a faculty development program, so you are a faculty, then so as of now there are so many robots are available. So if you are giving all kind of data into the robot can take any subject. So we don't want to keep, as per AACT, we don't want to keep like 12 professors or 15 professors. Simply by taking or by keeping only one professor, one robot, then can handle everything. But still, we have so many safety concerns, so that the robot doesn't know like the emotional things. But again, one more thing is coming: artificial intelligence, same like artificial intelligence, emotional intelligence. So we can give the robot emotion also. So then when I was attending one EdTech conclave, then there were like the people were asking Mr. Logesh Kanaras, the famous movie director, how this AI is going, how the AI is impacting that cinematic field. Then he was stating that yes, without AI, so in future then we cannot continue the the cinematic field. So then he used so many AI tools in movie. The same way, like he was stating one more statement that uh, AI can come and AI can go with the help of AI. So what are the things we can do, then that we can do. But AI cannot write scripts. So the script can be written. The script can be written only by the human side. That is what the important thing. Also, the same people were asking that one of the famous microsurgeon in Coimbatore, that he was stating that the least affected area is called medical. The least and lost affected area is called medical. So since there are so many things are available in the field, the lost affected area is called medical. Because sorry. So when there is an accident happens, if someone is going and asking, so the particular people, or when accident happens, any severe blood is coming or severe trauma is happening. So at that time, that particular patient will think so only the hope. So the people will think only hope. So like whether I will be okay or if I go to hospital, then I will survive or not. I will survive or not. So am I right or not or wrong? So likewise they will think. But at the same time, if you are keeping any kind of robots when it is moving to the particular place and it is taking SpO2 and it is taking the image of the patient and it is seeing the blood bleeding, and all of a sudden if it is telling you, so you will survive 50%, you will not survive 50%, patient will die immediately. So that is what the emotional intelligence that machine is not having as of now. People who are having. So this you see like so AI is a baby right now. AI is a baby right now. So like when we were the baby, so we were not knowing what is color and we were not knowing what is shapes or pen, pencil or any kind of things. But our parents or our teachers were telling us this is color, this is shape, this is letter, this is a numeric, this is alphanumeric. So that is where like we were learning. But after learning all these things, we are able to frame the sentence and we are able to come up with a good product development. So that time we are asking the same teacher or parents. This is not blue color, this is sky blue color. Same way, as of now, AI is a baby. By giving all our data, simply we are making the AI to learn each and everything, even emotional. So in future, so because of this robot, yes, we are going to lose our jobs. So that statistics also you can see. So India is going to lose almost 24.3% of the jobs in 2030 within 4 years. Within 4 years, we are going to lose. So India is going to lose 24.3%. Germany is going to lose 3.4%. Mexico 3.6%. Japan 6.1%. USA 40.8%. And China 47.8%. So this is what happening right now. So one more thing. So you see, AI won't replace you, but someone using AI will. So which means that in future that competition is not between man versus man, or not machine versus machine. So it is like, even it's not like man versus AI. So this is the battle is between man with AI, or I mean the human with AI versus human without AI. Which means if you are a professor with AI, or professor without AI, which means the person who knows AI can survive than the person who is not knowing the AI. So as of now, so we as a human being, we should know, we all should know how to use this AI. That is what thing. So we are having right now. That's because of this thing, AI won't replace you. I'm using AI will. Okay, this is what the market overview. So that then you can see that emerging technologies, most of the emerging technologies, you can see like top 10 device areas. You can see the top 10 device areas. In vitro diagnostics, on cardiology, diagnostic imaging, orthopedics and ophthalmics, and then general plasticity, endoscopy, drug delivery, dental, and diabetic care. So these are the areas like we are experiencing so many things. The company-wise growth also you can see in 2017 in billion. So also like so slowest growing segments also, like you can see the diagnostic imaging, mainly like orthopedics, and also you can see, so in 2021, so what that CAGR rate was $39.3 billion dollars. So $39.3 billion dollars. But right now you see like we are expecting in 2030 $80.6 billion dollars. So you see so many technologies are coming. So there I can tell you one example. So the company called Omron. So the company called Omron Corporation, there is a very famous company for developing BP apparatus. Famous company for developing BP apparatus. So BP apparatus, digital BP apparatus. So that will give you only like 160 mmHg pressure for adult. For baby 120 mmHg, and for maybe like the people who are obese. So for those people it will give you like 220 mmHg. But so whenever so you are giving so the particular machine, when you are connecting the particular machine to for babies or adult or someone, that someone will experience, or they will experience pain. They will feel pain because of the pressure. For someone they require only 100 mg. For someone they require like 150 or 200. So it depends on the, but always that machine will give you constantly 160 mmHg. Because of this they are feeling pain. But as of now that Women Corporation is having the technology called, so the emerging technology called, so intelligence. Intelligence means intelligence. So we are giving intelligence. Case to case or patient to patient, automatically it will adjust the pressure. Case to case, automatically it will adjust the pressure. So if your body requires 160, it will be 160. If your body requires only like 70, it will be 70. So that way we can simply. So there are these kind of technologies are available right now. So next. Wait. The same time when emerging technologies are coming in the field, so challenges that medical business faces also is there. One is called increasing competition. So there are so many competition happening between each and everyone. And then regulatory hurdles. So regulatory challenges are there, like as per the risk class A, B, C, D, likewise the so many risks are there. And data security. Data security is very important right now, and cost of the product. So cost is changing dynamically. So these are the medical device challenges we are facing right now. And then market overview, you can see like so challenges impeding the growth of the medical device market. What are the other so challenges are coming into the medical device market? The first thing is called growing pricing picture. So like so when days goes, like the price of each and every raw material is coming, increasing. So there is called pressure to reduce medical device prices, key concern for the industry. So if price is getting increased, raw material cost is getting increased, how we can reduce the cost of the medical product? That is what main concern we are facing right now. Changing consumer demands, case to case. So the consumer demands are changing. That is the main thing. And non-traditional entrance. So people are coming from different industry, automobile to medical, mechanical to medical, even civil to medical. So different people are coming in different things. That is called non-traditional entrance. That is also we are facing right now. And then increasing number of startups. Increasing number of startups means there are so many. There are so many startups are coming the way. So automatically the competition happening is in between each and every company. That is one kind of challenge. And rest related to geographics and need for evidence and cybersecurity risks. So these are the challenges. So embedding the market of the, growth of the market, device market. So then each and every medical device always we should ensure so user and fashion safety. So for any device you are manufacturing, like then you should know like for what purpose of use that you are developing, and then you want to, you want to hear that user needs and design inputs you want to get it from the people, and then design verification and validation. So these things are very, very important for ensuring the safety. So also you can see, so capture the report and analysis and share, learn and improve, implement and learnings and measure and monitor. So these things also very, very important for ensuring user and patient safety. So this is what the introduction. So introduction of smart manufacturing. So as of now, so in industry, in healthcare industry, so it's very, very like uncommon industry. It's called uncommon. It's called healthcare industry. So healthcare industry, robots we are using, sensors we are using, monitoring tool, instruments, like all these things we are using. How to maintain? So by using that latest technology, how to maintain the proper manufacturing process? That is what thing. So this is a data-driven and automated and adaptive production system. So each and every area, like we are keeping a sensors and conveyor systems, and then we are simply monitoring and we are using robots. By the way, like we are simply monitoring each and everything. So here then we are using IoT. The emerging technology is one kind of emerging technology is called IoT. That is called digital triad. Digital triad is nothing but by combining three different kind of technology. One is called IoT, Internet of Things, plus edge computing plus AI. So this is not only for manufacturing, also this is applicable for machines. For example, if you are taking a ventilator, so before 50 years, so we were using like mechanical based ventilators. So completely knob or rotatable knobs that can take the data. So after that, we use electronics based and sensor based device. Electronics and sensor based devices. There, sensor can take or sensor can give you what kind of problem we are having. But also, like as of now, we are adding artificial intelligence. So if there is a problem in Coimbatore, most of the industries, textile industries, were incorporating this. So artificial intelligence their textile mills. So each and every area, so it can take which conveyor is having problem or what kind of problem we are facing, or simply it is replacing the manpower and we are taking it. It's called IoT plus edge computing plus AI. So this is what edge computing is nothing but, so you are taking the data from the particular machine. So you are giving to any kind of ESP32 or so STM32 or modem MCU. So on spot you are analyzing by using AI. That's called edge computing. Cloud computing is something but, so you are taking the data and you are taking the data and you are sending it to, so you are taking the data and you are sending it to the cloud. From the cloud we are analyzing everything. From the cloud we are analyzing everything and we are taking. So that is what, so cloud computing. So the relevance you can see like widely used in the general industries, but so critical in medical and healthcare manufacturing, because we want to we want to concern like patient user and then biocompatibility issues and all we should take like. So this is what smart manufacturing. Then we are facing like robots and HMI, human machine interface. So by touching or by maybe like speaking or by using different kind of things, then we are that one we are maintaining, and sensor and then monitoring tool and instruments and control systems. So these all the things then we are going. Then so then you can see, so like this is what in the late 18th century we were using power. If you take small thing, water and steam based power. In the early 20th century, like you can see assembly line, and in early 1970s, so 1970s, so like, we were using this technology, but today and the development process you see like PLC and robot based thing. And then fourth revolution you can see Internet of Things and Internet of Services, CPS. So complexity is getting increased, but you see like the development of process and getting improved. So that is what thing is happening right now. So in emerging technologies, the one kind of technology is called Internet of Things in manufacturing. So wherever you are manufacturing any appliances or car, maybe any camera, any wearable, or any kind of medical equipment, so there you can see that network of interconnected sensors. So many sensors you can use. So with the machine and the devices that communicate the shared data in real time. So the data can be shared to each and every area. That is called so Internet of Things in manufacturing. Key application. So machine status monitoring. If there is a problem in the machine, MRI machine or CT scan machine, maybe any kind of a coil issue or any altitude problems or sensor data, everything can be monitored and it can detect the failures early. So then that will help us to go for predictive maintenance. So if you're predicting that predicting the predicting the downtime earlier, so we can, if you're predicting the problem earlier, so you can reduce the downtime. That is what the importance of predictive maintenance. Predictive maintenance. And then real-time tracking. So you can simply track everything in real time, and then production and visibility. So what are things happening, which convey is not working, which production is not working, everything you can so take it in real time. That is what real time tracking. Digital twins. That is very important technology. Digital twins. So it is nothing but so what are things happening inside machine that is replicated or whether it is duplicated here in the console or maybe the system. It is called digital twins. That is also there in IoT, Internet of Medical Things. And then you see like new age mechanical ways like product design analysis. Then we do use like ANSYS or the console multiphysics or phony CAD tools. That is also playing everywhere. Artificial intelligence, as you mentioned, like so everywhere that we started using artificial intelligence. And then core mechanical areas also we started developing. So since why it is called new age mechanical engineering means that for mechanical production line that it was mentioned. So industrial automation, and then IoT and Industry 4.0, 3D printing, robotics and mechatronics, electric vehicles, all these areas that these kind of emerging technologies are playing a vital role. Sensing devices. So this is since we are going for so wearables and portable devices. So IoT solutions plays a major role. Sensing devices. If you want to sense the temperature of the soil or temperature of the patient or hydration level of the patient or radiation level or any kind of ECG, EMG or camera or anything you want to measure. So that sensing devices can be used. That can be communicated through the particular data processing unit through like so Zigbee, Bluetooth, Wi-Fi, or LoRaWAN. Like so, after that, so that data can be sensed and it can be so correlated with the smart manufacturing tools. So that is what the important thing. And then data analysis. So the production floor, so or air conditioning, lighting, or managing everywhere. Like you can see, like this thing. So where production floor is like machines are there, air conditioning are there, lighting are there, managers are there. So always the managers cannot go and control whether like light is on or lights off. Always they cannot switch the air conditioning. Always they cannot see that machines. So like if you are using the IoT gateway in each and every area, automatically it can sense and it can give a machine quality monitoring and finally it can give a predictive analysis to the managers. The manager can come up with a solution like who is doing. So always the managers cannot see oversee that particular operations. That is what the thing important thing we do have right now. Okay. So this is what edge computing. So then initially you should know like what is edge computing. So like processing data locally. Local in the sense immediately or locally on spot. On spot we are taking the data. So on spot in the sense, for example, if you have any kind of MRI machine or ventilator or dialysis machine, inside dialysis machine, I can keep microcontroller. So then the data will be like the ventilator data or patient monitor. The data will be collected by that particular controller, so that everything can be sensed. All this can be sensed locally by using multiple algorithms. Then the data can be so I mean the predictive analysis can be given so by the device. In case this is what edge computing. In case if it is a cloud computing, all this data so locally it cannot be processed. This data can be transferred over the network. So the cloud. So in the cloud, the data can be rectified and then this can be processed. That is called edge computing manufacturing. So this is what like edge. Then you are simply taking or processing everything locally. That is called edge computing. And then cloud computing is nothing but cloud services, local servers by using server. So by using IPs or by security protocols like TCP, IP, or any kind of like AWS. Then you can take the data. That is called cloud. Okay, then this is called PSOC. So PSOC is one kind of a controller. So that is playing a vital role in edge computer devices. So PSOC, programmable system on chip. So lab on chip is also available. Like PSOC is nothing but program system on chip. Then that can be used for controlling robots, also human machine interface, also for security camera and smart home and wearables. For all these purposes, so this is used. Okay, so this is what I could right now, application layer. Okay, so when you are coming to artificial intelligence, so the area we are seeing like IoT in manufacturing, smart manufacturing. This is like artificial intelligence in manufacturing. So this is also to be used for machine learning, deep learning, and predictive analysis. So each and every tools are used for predictive analysis right now. Key application: predictive analysis, AI-powered robots, and demand forecasting. For these are the things that we are having right now. And then also like this kind of AI can be used for all areas. So now, so if I'm asking any kind of example from you, so name some AI tools. So you will tell like so ChatGPT, Perplexity, and then Gemini, or any kind of Copilot and all. But it's a tool. But if we must use the application where we are using, so I can tell you Google Map is using AI, Amazon, Flipkart, and then WhatsApp, and then Instagram, Facebook, each and everything. So it's using this machine learning, deep learning, I mean AI. So we are not using our mobile phone. The mobile phone is using us. So mobile phone is completely controlling us. That is what the importance of AI. So this AI can be used in. So this AI can be used in finance, gaming, and then astronomy, healthcare, transport, agriculture, and then education, e-commerce, and even entertainment. So and then robotics and automotive, social media, data security, in each every area that we are using this thing. It's called so the AI. Okay. So that is what integration that as I mentioned earlier. So triad. So IoT plus H plus A is called smart manufacturing. This is examples in general industry. Then as I mentioned earlier, it can detect vibration or temperature, noise, all these things. It can be predicted. Okay. What are the benefits of integrating these kind of technologies? Means improving efficiency and reducing downtime and quality and consistency can be improved. Also, like real-time decision making, lower operation cost, and regulatory compliance in sensitive industries like medical device manufacturing. That is also possible. So these are the things as of now we do have. Challenges is initially high initial investment, cyber security concerns are there. So and then integration with legacy systems, need for skilled workforce, everything is there. So like as of now, I'm going to show you a few technologies we have right now. So that is called one is called so importance of real-time diagnostic technology. So this is one kind of famous technology we do have right now. That is nothing but so you see that is one kind of a robotic surgery arm. This is what robotic surgery arm. So before like getting to know so like what kind of a problem we are having inside our knee, any problem or any issue, if you want to diagnose that thing, so there you can go for this application. That is called so I mean I can tell you. So you see like this is a leg. So as I mentioned earlier, if doctor is taking MRI or CT and all other such things, and doctor is telling you so you want to go for a knee replacement. So blindly we don't want to believe the particular doctor. Then initially, so we should take 2 to 3 consultation differently, and we should decide. So then here I can tell you. So these devices, I mean these photos are not were taken from the internet. So this was taken from one kind of expo which was happened in last year, Arab Dubai. This is the result will happen. So here you can see when patient moving their leg. So here we are not taking any kind of X-ray or MRI. Simply by placing the sensor in the legs, and when we are moving, automatically it is taking the data. So when we are moving, you see. So here then, so this is the femur and this is the tibial bone. So here you can see like 5.5 millimeter, 5.5 millimeter gap. So here we do have 4.5 millimeter, which means 1 millimeter is extra here. So 1 millimeter extra means here it is curved. So then arthritis happened here. 5.5 millimeter means arthritis happened here. That is what the thing. So also like flexion, extension. So valgus or flexion, everything can be taken here. So it's like gonimeter when you are moving your leg like this. So 117.5 degree or 10.5 degree extension, or what's the angle on occur in knee state. So also that it can occur the knee state, and there normally everything can be so mentioned over here. This is one kind of very good technology. So if you are having this kind of technology, then in future we don't want to go for. So we don't want to go for any kind of X-ray or MRI. That is what that importance of real-time diagnostic technology. And then, so this is one kind of a thing. So since we are a human being, like then since our since our sitting position or walking position is not proper, so we are facing so many problems with the spinal cord. So that spinal cord things can be differentiated like this. So either whether you want to perform a surgery in cervical or maybe like lumbar, so wherever you want to do the surgery, so that vertebra, so where you want places to, so C1, C2 or C3, so everywhere then you need to mention there, mention like this. So as per your convenience, then you can see. This is called, so this thing, so different kind of a identification system. So this was happened recently, like when we have seen one case in Salem, when doctor was doing surgery for the family planning after the birth of two babies. The particular lady wants to do surgery for to go for family planning, and doctor was doing the laparoscopy. So when he was doing the surgery, all of a sudden he was scratching that intestine. So intestine, so it's scratched. So all the waste material from the intestine was coming out of the intestine, and it is getting into the stomach. And within 1.5 days, he expired. When we were asking doctor, doctor was telling, so I was not getting, clarity in the image, laparoscopy. Visibility is not, good. So when he was doing, so visibility is not proper. So that time, so that industry is coming up with a good solution. If visibility is not poor, or if the doctor is not knowing, so which is lungs, which is heart, or which is intestine. So then as of now, by using CA technology, so we can incorporate so different things, like we can incorporate in the sense like we can differentiate different colors for the particular organ can be. So classify into different colors. The doctor can get a clear cut idea. So this is lungs, this is the intestine. We should not touch over here. So that is what we are having right now. So this is very good technology. The next is called. So this is already it is there in the market. So as of now, we do have more wireless technologies. So if you want to identify ischemic condition of the patient, the patient will be asked to run on the treadmill. So by connecting all ECG electrodes, the patient will run on the treadmill. That time we will be taking the ECG, and then it will be monitored on how many beats or how many missed beats, or so what was the ECG, what was the ECG level, whether it was increasing or decreasing, everything was so monitored by using, everything was monitored by using this thing that is called, so stress test analysis system. Stress test analysis system. That's great. So the next is called. So this is one kind of emerging technologies as of now. It is there in all other countries, but it is emerging in India. So for hospital, if you want the oxygen supply, then we'll be taking it from water, H2O. So we'll be taking it from water, but that particular water. So this is a big process. We should have a big plant, then only we can able to take these things. But as of now, so this thing you see like this kind of a plant, so it can extract the oxygen from the air. That atmosphere air itself we do have, so 21% oxygen and 78% nitrogen. So that out of that particular 100% of air, So that 21% oxygen only will be allowed so by the compressor and the geodetic material. It can be kept inside or stored inside that cylinder, and the stored oxygen can be circulated to entire hospital. That is what importance of real-time diagnosis technology. The pressure, so you can see, sensor-based thing. So then purity of the oxygen is monitored continuously, and then hours constant unit 1 unit 2. Then how many hours it was running. That also we can simply monitor, and then tank pressure. So the particular tank pressure also alarm auto system failure or ambient sensor failure. Pressure is high or low or normal or external alarm or power control panel alarm. So all these things you can get to know. So here. That is what so the important technology is as of now we are experiencing. Next. So one more technology as of now we are coming up with a different carbon fiber based solution. For example, this technology is very good. So in material science, I can tell you carbon fiber based things are very so good. Carbon fiber based is nothing but so when you are using this kind of carbon fiber based rods, it is used for so holding purpose. For example, if you want to measure the weight of the particular patient, if patient is not able to stand, so there are one more technology that weight of the patient can be completely monitored by using the patient bed. Patient bed itself, it will monitor patient bed itself, it will monitor so many things. That is what I think. But if you are not having that kind of feature, so what you can do is simply you can use this kind of a tool. Carbon fiber. Why carbon fiber? Carbon fiber is so it is having the properties called radiation. Radiation. Also, the patient can hold this in carbon fiber. At the same time, if you want to take X-ray or something also, you can take. So usually, the patient, the people who are not able to walk or stand or even sit. So if you want to take X-ray, it's very difficult. But by using this kind of thing, you can ask patient to hold this thing, and you can take X-ray directly onto the panel. So whatever the carbon fiber is coming or that this one is coming, then it will not come to the X-ray image. That is what the property is having right now. So most of the implants and prosthetics and exoskeleton, everything is designed by designed using this carbon fiber. This is what kind of very good technology. So then in this one you can see the company called Leader Healthcare. So they are coming up with a solution called this kind of a body. You can see this is a real body. So see, do not touch real body. So this is a Leader Healthcare company is one kind of a famous company for developing freezer box. They are the famous people for developing the freezer box. So by using this technology, so you can see this body, this real body, it was expired 34 years back. 34 years it was happened. It was processed inside that freezer, and you can see like material, like material sense without formalin. So by maintaining the temperature and humidity, using the lungs and then liver and then intestine and then joints and brain and then the nose, eyes and everything is muscle and then joints and then you can see like ligaments, tendons and everything you can see. So this is what one kind of a technology in freezer. So we'll be thinking like, so what kind of technologies are available in freezer? But inside freezer itself, so we do have so many technologies. So you see, so when we are traveling, so in this industry, so we were coming up with so many things. Like earlier, we used mechanical based systems and sensor, electronics, and AI. This AI also will get over and we will come up with another technology. So we should be able to adopt for the technology. That is what important thing. So here, so this thing you can see. So carbon fiber based material in OT, operation theater. Inside operation theater, this thing is called OT table that can be controlled by using this pneumatics. And if you want to, so positioning the patient. So for example, here we are planning to do the surgery. If you want to position the patient properly, so this is called the position system. So this is completely made up of carbon fiber. When you are taking X-ray or CT or MRI over here, it's mainly CT, this will not come into the picture because it is a radiation because it has a radiation property. And you see, like this one also for positioning. It's carbon fiber based technology for positioning the patient. So if you want to lift the patient like this, when you are planning to do spinal cord surgery, so simply you can so tight or they screw up over here. Automatically it will be like the angle will come. So that when angle is getting increased, so the patient positioning can be so kept like this. And this one also like you can see like carbon fiber based so extensions. And also like here you can see like this is OT light and then anesthesia workstation, and then patient monitor, everything is available inside. And backside you can see one more device called WOM. So that WOM device is used for capturing the real-time terminologies. So when we are performing the surgery. So when we are performing the surgery, wait, sorry, just wait. So when you are performing the surgery, so for example mainly brain surgery, neurosurgery. So when you're performing the neurosurgery, when you are taking patient into the operation theater, after completing surgery, if you are coming up with a solution called some problem or any issues, it is very difficult. So because of this one, then we are facing 95% of neurosurgery patients are so I mean not I mean so 95% of the people are not safe. So earlier, so before 5 years, we were not able to save complete 100% of the people. Only 5% of the people are safe in their luck. But as of now, by using this OAM, whenever you are inserting, whenever you are checking the patient with the help of OAM, so each and every time we are able to ensure everything properly. For example, if you are if you are inserting that particular knife into the patient skull, whether it is going properly or not, that we can check. So left side you can check, right side you can check, upward you can check. So everything you can check. That is called the importance of warm. So because of this thing, so we are coming up with a solution called so almost 90% neurosurgery cases are safe. So we can able to recover the patient from the trauma. Only 5% or maybe 2 3% are not safe because of the severe trauma. So that technology is available right now. This is what warm. The next is called. So you can see like diagnostic process. This is what brain surgery. So this thing is called brain skull surgery. So the ventilator is started like this. So here also we are using carbon fiber based positioning things. It's called horseshoe. And this is also like cervical surgery. So they are performing surgery in the back. So spinal cord. So this is also happening. What's next? So this is called so overall the medical systems like we are taking healthcare activity. So basic parameters called that data acquisition part. Then we are coming with so much advancement. I mean emerging technologies and the respiratory support and brain electrical signals and SpO2, ECG, BP, respiration temperature. Also like so these already like so we can take it as analog or digital sensors. So that is also available right now. So then we are using so much technologies like enhanced diagnostics. As you see, so we are simply talking about AI. So AI medical, AI in healthcare. But already the company called company called GE Healthcare, they introduced so AI based reconstruction technique in MRI. So for taking single MRI, it will consume like almost 45 minutes. But by using this AI-based MRI machine, you can complete the complete scan within 12 minutes. So the company is selling or promoting the equipment by telling per day you can scan 125 patients. So likewise, you are having machine learning, personalized treatment plans, also natural language processing, predictive analytics, and computer vision, streamlined administrative processes. Likewise, so many things we have right now. So also bioelectrical signal acquisition, acoustic signal, and biochemical signal. I guess you are having so many things. At the same time, so you see challenges in biomedical, the noise. So noise is the one. So the main challenge for biomedical engineers or biomedical signal acquisition. So that signal also can be removed by using various software filters. As of now, the technology is like, so we don't want to use any kind of hardware filters. So simply by using software, then simply can remove. The tools are available. Data acquisition systems, as you know, like, so this I'm not going to concentrate. So embedded boards for DAC, STM32, already know as Raspberry Pi, ESP32, ESP82, those things, there are so many things. Data interface. And then when you're going for that, when you're going for data acquisition part, so these are the place like it's very, very important. It's completely depending on ADC resolution and flash memory. So whenever you are increasing the ADC resolution, the accuracy can be increased. So then wherever you want to use low pass filter, high pass filter, band notch filter, that you can use. So analysis techniques as you know already. And then segmentation. When you are planning to do segmentation, data acquisition, QoS, component extraction, feature processing, ROI, and reduction, everything. So we can see here. EEG event segmentation, there is also there. This kind of things are technologies. So as of now, so how that the Apple company is having the technology by simply placing an AirPod inside ear lobes, it is taking the brain signal and it is analyzing. The same way, so we are coming up with this EEG based event. So in a gaming pattern, for example, if you're asking patient to do some physiotherapy, they will not wait. Also, if you are having some gaming kind of a thing to complete that physiotherapy exercise, they will wait. So what we are doing, like we are taking each and everything through that for all neural cases, we are taking everything through the gaming part. So HRV, heart rate variability, like to time or beat to beat. So what's the time interval? How we can predict that also. So we can simply monitor that is also available. So frequency analysis and statistical features, everything is available here. And then overlay of AI in biomedical engineering, you can see. So externally the transparency and benchmarking and uncertainty, robustness and data quality, reference data, comparability, and medical products, diagnostics, therapy, preventive measures, all these areas. So we are using for this thing. This is a normal machine learning model, so I'm not going to concentrate much on this. And this is lead training model, so AI based analysis. So this one already you know like so convolution neural network. So for medical image analysis, signal processing and everything. This is called arrhythmia classification. This is called arrhythmia classification, and this is a variable rhythm monitoring. Arrhythmia classification is very, very important because so if you are taking ECG, if ECG is okay, heart rate with the help of heart rate or in the inside machine, then we will have automatic interpretation. It will tell you heart rate is okay, or I mean normal sinus rhythm, or bradycardia or tachycardia. In case if it is not okay, bradycardia, tachycardia will tell you, or sometimes atrial fibrillation, ventricular tachycardia, everything it can tell you. If there is a heart attack, so whether it is predicted by ECG machine or not means it is not at all possible. So ECG machine so will take only the changes. But if you want to confirm the problem, then again doctor will advise you to go for blood test, trophine test, and then stress test, and finally like echocardiogram, and then he will ask you to go for angio. So then you want to take so many steps in between these things. But by using this AI method, simply by taking ECG waveform, you can analyze what kind of problem you are facing. It is possible with this AI. That is what the importance of what we are facing right now with this AI-based algorithm and wearables. So wearable is very, very important field. I will show you a few portals for wearables. There you can take more research ideas. So by using glasses, by using mouth guard, and then clothing, strip, belt, and then headset, armband, watch, ring, shoes. So we are taking too much data, and also we are monitoring the patient. So using this a wearable with a so that is what the advancement right now. So best example is smartwatch. Simply by wearing a smartwatch, you can take or you can measure multiple things. Application case studies, hospital applications, ICU monitoring, intelligent alarms, predictive patient warnings, smart biomedical devices. As I mentioned, sensor failure and everything can be monitored by smart biomedical devices, telemedicine, remote diagnostics case. All these things are available right now. Challenges and future trend, you can see challenges of data privacy, need large data sets, noisy variable biosignals. This is challenges. Future trends, you can see personalized AI healthcare, edge AI variables, and AI plus robotics in medicine. Okay, so still I want to show you a few things. Just wait. So since you are from patient, I mean you are from variabletechnologies.com. Since you are from faculty background, so you are in academic side. So if you want to have any kind of research idea for your thing, you can make use of this port called variabletechnologies.com. So that is called thing. So there you can see like this portal is maintained by Germany. So the maintained by Germany, the country called Germany. So there, what are the portable or wearable ideas are coming, then that will be posted over here. So you can see December 2025, miniaturized temperature sensing accuracy. So miniaturized temperature sensing accuracy devices developed. So if you want to know like how to, you can watch the video and ASP223 supports smart health monitoring and who did this project, everything you can simply monitor. So what kind of a technology they are using inside that particular machine, that also you can see. Likewise, knee motion, smart variables to for knee pain relief. So you can see like knee pain relief. So they are placing one variable here and here, and it is therapy to reduce knee pain, vibration therapy to reduce knee pain during activity. So the product called Nemo uses motion sensing technology and vibration therapy. So it is giving vibration, and it is so curing chronic knee conditions. So that is called what kind of a thing. So knee motion, and then transform cancer care with variables or new flexible material could power next generation variables. And here's exoskeleton with swappable knee and hip models. You can see exoskeleton with swappable knee and hip models. So simply you can swap so knee and hip models that is available. So likewise, so many advancements are available. So these all things are available in abroad, but it is not available in India. So you can see Apple unveils next generation AirPods. So that you can see. So AirPods Pro with exceptional in-ear active noise cancellation, also heart rate sensor. So inside this sensor itself, we do have heart rate sensor. So it will take heart rate. So that is available right now. Like this. So whenever you want to monitor or whenever you want to have some idea, that there you can see so many ideas. You can see like here the big health devices investment. Also like knee sensor user to drink water. So this sensor is alerting the patient to drink water. Knee sensor is taking hydration level. Simply it is taking hydration level. That is also available. Also it can be used for so electronic bandages that they will use wound treatment. It also can be used for wound treatment. And you can see like smart capsule can monitor your gut from inside. So inside health, the gut from inside. So if you are taking this into our stomach, it is monitoring our gut health. This is also available. Like so many products are available over here. So it's a product. So already it was approved by their other country. It is used by other country to sleep tracking armband. Also you can see new contact lens and tiny brain sensors fits between AirPods, follicles. So you can say like boots that relieve leg pain. So if you want to relieve leg pain, simply you can wear this thing, automatically it will relieve the pain. That is also available here. So many products are there. I want to show you a few things. So this one is from this one is so noise entry into smart living space is particularly notable for this development in India. So you can see like so this is a so the actress actor was wearing a smart wearable So this variable is taking so many parameters. So this is called learning. Slim image design and inclusive blend of fitness tracking features. So it is mainly used for fitness tracking features. So access was using this thing. So that also you can see. Likewise, so when you are accessing this website, then you can come up with so much thing. Also there it will be mentioned innovation of the month. So this month, this December month, it was awarded as innovation of the month. So this one was like November month, and this one was from October and September. Likewise, each and every product you can see. So also this one also very good idea. Remote health with smart patches. So if you are simply pasting this patch into the patient body, automatically it will take the data and it will transfer the patient data to a particular device. So there you can see like you can take complete things. So this is also like very important or very good revolution. And then so many things. What industries? So you see like this one, temp track. So if you want to monitor the temperature of the patient, if you want to track the temperature of the baby, mainly baby, so you can use this sensor. Simply you can paste this electrode. It can take all the data from the baby. So you can keep settings also like notification settings also you can maintain there. So you can see that when the temperature was increasing and decreasing time. But what time is increasing and it is decreasing, it will tell you. So you don't want to check each and every 4 hours or 2 hours or an hour once. So it will take all the parameters. So this is one kind of wonderful technology. So when you are taking that brain monitoring, when you are working with brain monitoring devices, so placing an EEG electrode is a very difficult part. Placing an EEG electrode is a very difficult part. So there, so you can use these kind of electrode as a comb. You can use this kind of electrode as a comb. Then simply you can use this sensors. This is electrode. So wherever that silver coated is there, then it is used for tracking. So that is thing. So likewise, so you can see so many things. Also as a, I mean also as a faculty. So if you want to so teach the students on circuit, so then you can use all start circuit simulator. So if you want to teach the students on circuits, so you can see like circuits, basic Ohm's laws and Thevenin's law. For example, if you want to teach how capacitor functioning, so they can see like charging and discharging. Time constant, you can see, you can tell them 20 milliseconds time constant. Also, when I'm increasing the capacitance, the time constant will change, will increase and decrease. By this way, you can teach. So by this way, you can teach the students. So like so many circuits are available. AC circuits, passive, and other passive circuits, diodes. All these things are available here. And one more thing. So I can show you one more tool called Oakley. This is one kind of a simulator. So ESP32 or Pico or ST32 simulator. So if you want to do something with ESP32, so then you can choose ESP32 S1, S2, S3. So there you can put a code. So you can see like you can add component. This is the capacitor like this. So that wiring also can perform like this. This wiring also can perform like this. So then you can put a code and you can run. So that way also you can check. So this circuit simulator about we can use it for so circuit based things. So there, so as a conclusion, so you can use the emerging technologies is called IoT, and then artificial intelligence, IoMT, and then digital twin, and then wearable and edge computing. So these all things are called that emerging technologies of now. This technology may change. So in future, the technology may change. So like so prompt engineering is one kind of technology or kind of field as of now is booming. So that is what the main takeaway of this session. So thank you so much for giving an opportunity. Right now, maybe we can have a, I mean QA. So maybe we can have a Yes, any questions you can ask. Any questions?